Supervisor Scott, would you lead us in the pledge, please?
Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So we also have another extra item on our agenda, 4.2, consideration of extra agenda item, and B, consideration of agreement with OptumServe mobile vaccination van and team. At this moment in time, I would like to start off with at least the consideration of the item, and then we'll go ahead and bring this item in when it's appropriate. If this can be introduced, and I believe we have Director Pomeroy on the Zoom room with us.
Good morning, Chair Sabatier and Supervisors. Thank you for taking the time to listen to this request for an extra item. This extra item is being submitted as the item came to my attention subsequent to the posting of the current agenda, and there is a need to take action before the next agenda. Lake County Health Services has been working with the state vaccination team to acquire a mobile vaccination team to be assigned to Lake County. As of the end of this week, our Optum site that we do have will no longer be available to us as a brick and mortar site, and the response team has determined that there is a higher need for a mobile site that can go and move around the county to different locations to better serve our community.
And Director Pomeroy, I'm going to interrupt you. I'd love to get into the meat of this agenda item, but at this moment in time, if we can just quickly get to the reasons for why this is an extra item, so we can go ahead and place it as an agenda item so we can discuss a little further.
No problem. I'm sorry, I don't do extra items.
No worries.
I think this is my first one ever, so I apologize. Friday afternoon, we were notified by the state that they had approved our request for a mobile vaccination van and team in order to get them here by next week, Monday, which would be before our next agenda item, so that they will be present all 4 days at the fair to give vaccinations.
Perfect. Thank you so much. Any questions from the board, comments, or any action? At this moment, we have to put it on the agenda in order to have public comment.
Mr. Chair, I move to approve the extra item 4.2.
Second.
We have a motion from Supervisor Scott, second by Supervisor Pyska. Roll call, please. Johanna?
Okay, Supervisor Crandall,
Yes.
Supervisor Scott,
Aye?
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
Just as a point of clarification, the public's also entitled to comment as to whether they think an extra is appropriate.
So she said that I needed to open public comment. My mistake. So let's go ahead and make sure open public comment. Are there any questions regarding adding this item as an extra item? Not specifically about the item yet, but any questions about adding it? Phone 4627, is your hand up for public comment on this? I apologize, Ms. Grant. Thank you very much.
Yes, good morning. This is Tom Slate, and I just wanted to raise an issue I've raised before.
Hold on. Is this regarding adding an extra item to our agenda?
No, and in fact, no, I do stand corrected on that, so
Okay.
I'll call in later. Thank you.
Please put your hand up when the agenda item you want to speak on comes through. All right, so let's go. We already did the vote. Thank you very much for clarifying for the public comment. Let's go ahead and move on. We'll discuss that further at a later time. Now to go over the consent agenda, I would like to pull item 5.1 and 5.4. Are there any other items that board members or staff wish to pull? Okay. Is there anyone in the public that wishes to pull an item from our consent agenda to discuss further? Raise your hand if you're in the Zoom room by clicking the bottom button that says raise hand, or if you're dialing through the telephone, dial *9 and you will raise your hand. All right, bringing it back for action on the others not pulled.
Mr. Chair, I move to approve
Consent agenda items 5.2, 5.3, 5.5 through 5.10.
Second.
We have a motion from Supervisor Crandall, a second by Supervisor Pyska. Johanna, roll call, please.
Okay, Supervisor Crandall,
Yes.
Supervisor Scott,
Aye?
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
Thank you, and we'll take up those other two items at a later time. I want to make sure and respect the timed items. So our 9:06 a.m. item, consideration of update on COVID-19, and I know that Dr. Pace is here with us. And
Morning.
he's back.
Good morning, Mr. Chair, and good morning to the board. Thank you for having me again to talk about a COVID update. I'm kind of helping out here as interim health officer until permanent replacement can be found. And so Sarah is not here, is not available today, so I'm going to go ahead and just go through her slides quickly. But basically, the situation is stabilizing, and we're optimistic that things are going in the right direction. So we can go to the first slide there. Thank you. So this is on the left side is the total tests performed, just to show that we are seeing a little bit of a drop in testing. We're the dark line. The state is the lighter grayer line on top. But we can see that we're basically following what's happening statewide in terms of a slightly fewer number of tests being performed. And then on the one on the right is the test positivity rate. We're the dark line, which is on the top, still quite high, but is improved from before. And as we know that when the test positivity is high, we tend to see an increase in cases and a lag time with increase in cases, and then a lag time with increase in hospitalizations over time. But so now this does seem to be dropping some. Next slide, please. This is the total confirmed cases. Again, the dark line is the county, the lighter gray line below is the state, and we can see that that's dropping. Next one, please. So this is a really interesting one. This is the Lake County data on vaccinated versus unvaccinated cases in the county from the first 2 weeks of August. So the bluer one on the left is not fully vaccinated that have become cases, and the one on the right, the dark one, is the fully vaccinated people that have turned positive. So there's a 7-fold reduction in your chances of becoming positive for COVID from the testing that's being done in Lake County if you're vaccinated. So if you're vaccinated, you have 7 times less chance of getting COVID. Next slide, please. So this is the epi curve that we show every week, and you can see on the right side that things are starting to drop, and the number of cases is improving, and this is Lake County. Next slide, please. This is hospitalizations on the left. This is Lake County hospitalizations. Looks like it's starting to flatten, and the ICU is starting to drop. So this is what we're seeing. The hospitals have been quite full recently, and we've been having some trouble with transport out, but the pressure seems to be relaxing some, so things are starting to improve. Next slide, please. This is the deaths, and so the one on the left is from the state. Unfortunately, we've had now 3 folks have passed away over the weekend from COVID, and that hasn't been reflected in the state data yet. But yeah, so we're really sad to have that situation come up, but that's what's happened over the weekend. Next slide, please. This is the graph of the people getting first doses. So it's a way of charting, are we seeing an increase in new vaccinations or a decrease? And this has dropped a little bit in the last week or so. Next slide, please. So this is an interesting slide. We now have a total of over 30,000 people in the county that have been fully vaccinated. So this is quite an accomplishment. We're still at 55% of folks 12 and older that are fully vaccinated, but this is now 30,000. So that's 30,000. Well, 60,000 for essentially doses that have been given now since the vaccine became available. So this is pretty exciting that we've gotten this far, and but that still means that 45% of the people that are eligible have not got are not fully vaccinated, and we want to try to increase that number. Next slide, please. Is that it? Okay, thank you. So I think the most important thing is to just acknowledge that the vaccine continues to be very protective against serious disease and death. We have seen in the hospitals, in our local hospitals, we're not actually able to completely track everybody to get good data on the vaccinated people that are in the hospital, but when we've taken a couple snapshots at different times, it's pretty clear that the vast majority of folks that are in the hospital are not for COVID that are not vaccinated. We now, there's a situation statewide where they're calling it load leveling, where hospitals that are under serious pressure are able to transfer patients to other hospitals in the area that have some vacancies. And we, as of last night, it looked like we were going to be taking 2 of them from Del Norte. So, because they're in a very difficult situation up there, and so I'm not sure if those folks came in or not, but that was the plan last night. So we'll have to sort of keep track of that data as well. But just to be aware, the state has shifted their rules now to make sure that the places that are getting most heavily impacted have an ability to depressurize the hospitals. And yeah, really sad to see these folks pass away this weekend, and so I want to just acknowledge that, and I appreciate Supervisor Pyska mentioning that earlier in the thing, because it hits us all hard when that happens with folks that we know. There is an outbreak in the jail right now. 7 staff are positive, 17 inmates, and 52 inmates are quarantined. So this is like a quarter of the jail that is being impacted. The correctional officers are working with us really closely, and they're taking the proper spread, the proper steps to minimize spread. But as you can imagine, the jail is a very challenging place with so many folks in there, and ventilation isn't the greatest, and everybody's kind of close together. So we're doing what we can to try to slow the spread there, but it's definitely an issue. So I want to talk a little bit about vaccines now. Pfizer yesterday was approved by the FDA, so it's fully approved now. It's no longer under the emergency use authorization. And this will, so this should reassure people a little bit more, folks that have been reluctant because of the incomplete authorization. That is now changed for Pfizer and Moderna. We expect that to be coming down the road in the near future. Also, boosters have been approved for the folks that are immune compromised, and the 3rd shot is being recommended now for folks that have been fully vaccinated starting 8 months after the 2nd dose. So some of the data has come out showing that there's been a decrease in immunity starting around 8 months, and so we haven't operationalized this yet. The details aren't out yet, but it looks like that's going to be what the recommendation is going to be in the near future. So as Denise was mentioning, the state support for the OptumServe fixed sites is ending, and they're here through the end of this week. We've been asking the state for some help to continue going, and they will give us this mobile team, but they're not going to pay for it at this point. So Denise is going to come forward and ask for the funding through the county from the CARES funds. We do really want to thank everyone that has helped with the OptumServe fixed sites over the last couple months, both the testing and the vaccine sites. So it's been a really good collaborative effort with some of our county partners, and we really appreciate that, being able to continue after we decreased and ended the mass vaccination sites. So there's a plan to set up a vaccine site at one of the entrances of the fair. A lot of the details are still getting worked out, but we're hoping to get it set up so that folks that need vaccination can hopefully get one, and we're working on getting a free entrance for those folks. So the hours and the specifics are still being worked out, and we're getting some help with some local partners as well to do the vaccines. But this is part of the way to try to get vaccines out to where people are at, and Supervisor Sabatier and the supervisors have been really encouraging us to go this way, and it seems like a good idea. So there is a special event on Thursday in Kelseyville that's been put together with the help of some partners, Adventist Health, LCOE, and there's some Farmworker allies from Sonoma County that have helped us put together this event on in Kelseyville Thursday afternoon from 3 to 6, and there will be information on our website. It's for farm workers as a target, but it's open to everybody. So if people want to come and get it there, that's a way to do that. I want to talk a little bit about testing. Again, the state support for the Optum sites is over, so they are giving us a capability of doing some testing around the lake, at various sites around the lake. We're still working out those details. So next week we'll be sort of ramping it up. We're not sure exactly what the details will be, so we'll be putting out the schedule for that. But just to let people know, even though the support for the current setup is over as of the end of this week, we are going to have testing, and we are going to continue doing vaccination sites. And we're just, they just cut us off last week, so we're kind of in the process of scrambling to get all that in place. Contact tracing, case investigation, we are really shifting our energies away from that now. We just don't have the staff to continue doing all the different pieces, and it seems like where we're going to get the most impact in preventing the spread of future pandemics is by working on vaccines. So there is some state staff helping us with contact tracing and case investigation. But the focus here is going to be for folks, if they're symptomatic or if they're a close contact, to go get tested. If you are positive, you can get some information on how to isolate and quarantine, and to contact the people you've been in touch with so that we can try to stop the spread. But we're going to have to really ask the community to sort of step up and do that themselves. We've been doing this for a year and a half now, and I think most folks know what needs to happen. We'll have a phone line that people can get their questions answered, but we're not going to be able to be calling everybody up now that's a positive case. The schools are a really important piece of this, and I think we're going to be talking about this more and more going forward. Right now, the 12 to 17-year-old group is about 80% of them are not vaccinated. And in the 18 to 49-year-old group, which is the parents of school-age kids often, 55% of them are not vaccinated. So here we are putting all these kids into the schools, and yet the vast majority are not vaccinated, even if they're eligible. Under 12 is not eligible at this point, but the older ones are. And we really want to try to encourage both the kids, the parents of the kids, and the school staff to get vaccinated if at all possible. Last year we really had most of the schools not open for the vast majority of the year, and it's not good. And the best thing we can do to try to keep the schools open is to get these groups vaccinated and to have the kids wearing masks at the school. So we're going to be seeing outbreaks. We're having some cases coming out of the schools now, and we really want to keep these schools open. So we're going to be putting more and more focus on these groups to try to get the vaccine taken care of so that the schools can stay open. I think what we're going to be seeing is this surge looks like it's starting to come to some closure, and it's going to start improving here in the coming weeks. But very likely we're going to be seeing another one in a couple months that could be some mutations with variants, and also with people going back indoors and with flu coming. It just really looks like the fall and winter could be a real problem. And so we really want to get people vaccinated now in preparation for this next surge. So just a few more things and then I'll be done. I did want to address a few of the concerns that keep getting brought up in the public comments when I've been listening to the meetings the last couple of weeks. One is about ivermectin. This is a medication that's been used in veterinary medicine for quite a while. Some people feel like that has some activity against COVID. They did a big study recently, and they found that there was no evidence that there was any real improvement with it. So we are definitely not recommending using ivermectin. There was some talk previously about different vitamins, vitamin C, vitamin D, and all those are probably a good idea. The studies have, we haven't really seen clear evidence that they are preventive, but they're low risk, and it seems very reasonable to go ahead and try to use that if you want to. I think the main thing is not to do those things and then ignore the other recommendations of the masking and the vaccination, the things that we have evidence that really does work. These things like ivermectin and hydroxychloroquine, we have evidence that they don't work. The studies have been done and they don't seem to help, and so I would discourage people from doing that. But the things like vitamin C and vitamin D are probably a good idea. I've also seen some concerns raised about the PCR testing, and we're using these all the time. They seem to correlate with what we're seeing with the illnesses and with hospitalization. So I don't really think that's it seems like more of an abstract academic kind of concern, because in real life, this is how we're identifying people that are sick and trying to prevent it from spreading and from them getting sicker. So I would, I think the recommendations are, I know they've been changing some over time because this is a new virus and we're trying to understand it as it goes along, but I think the evidence is pretty clear that vaccine and masking is the key to it all. So again, it looks like, so in conclusion here, it looks like the surge is settling down, and we're really saddened by the loss of some of our community members over the last weekend. So please support those families if you know them. And there are likely to be future surges and future variants. So I think, developing good habits now and getting vaccinated now is going to help us in the future. It takes, if you got vaccinated tomorrow and you got the second one 3 to 4 weeks later, it's still 2 weeks after that before you have full protection. So it's about 6 weeks from when you decide to get going. I think we're going to really start putting a lot of focus on the schools and the kids and the parents of school-age kids, encouraging them to get vaccinated. So, the messaging is probably going to be coming out, and we're going to be trying to work with the schools to see what we can do about that. I think also we need to kind of work with the local nursing homes and the healthcare facilities to encourage them to get their staff as fully vaccinated as possible, because I think there's a little bit of work we can do there to get it, because those folks are particularly vulnerable in getting it and spreading it. So, and the last thing is just that if you have symptoms or are close contact, get tested and isolate and quarantine and let the people know that you've been in contact with. This is how we're going to slow the spread of the pandemic, is by, when people do get it, to take themselves out of circulation. This Delta variant is very, very contagious, and we're just seeing how some parts around the country are getting really heavily impacted. I think we have now, we've been feeling it the last month or so, and again, but it looks like we're probably going to be coming out of this surge in the near future. So that's all from me now. Thank you.
Thank you very much for your presentation. Are there any questions from the board? Supervisor Pyska.
Thank you, Dr. Pace, for that update. I have a couple questions. I guess, a lot of people have been waiting for the Pfizer approval, and just so it's really clear to everyone, where are the opportunities to receive that vaccination throughout the county?
Yeah, thanks for asking that. So at this point, you can go through your medical providers. Most of the medical community is providing vaccines. And the other main place to get it is through the pharmacies. Most of the pharmacies are giving them. We've actually, this week, we called around all of them just to see what's the availability. Are people able to get appointments? And most of them that are giving them said they have walk-in capacity. People can just walk in and say they want it, and they can get it within 15, 20 minutes. And nobody's at capacity right now. So there is availability around the county. The health department now is doing a few clinics But I think, we're going to be probably shifting our focus now. We do have this Farmworker event on Thursday afternoon in Kelseyville. So, there's different places around. You can go on the website and look, but I think the easiest way to do it is either go through your provider or through the local pharmacies right now. That will change because we were doing them at the Optum Serve sites, but now that's going to be eliminated. And depending on how things go with the discussion today, later on the day about the funding for the mobile unit, we may have other sites set up around the lake at different places, different days of the week to offer them that way as well. But there's going to be the Pfizer approval, so I think that's going to increase demand, and then also the third booster is going to start coming online here in the next month or so, so that will be another thing. But I think it's really, really important for the folks that are not vaccinated at this point, anybody who's open to thinking about it, to get your questions answered and go get it done for this next surge that will probably be coming in a few months.
And when do we think the approval is going to come for the Pfizer for the 12 to 17-year-olds?
Pfizer is already approved for 12 to 17 year olds.
Oh, okay. I thought it was just for 17 or 18 above. Okay, well that's
No,
excellent.
no. So I'm glad that you asked that. If that's a confusion, 12 and above can get the Pfizer vaccine right now. So if you have a teenage kid and you're interested in getting it, we just need to get you hooked up at one of the sites that offers the Pfizer vaccine, and they can get it.
Right. So we're kind of in this middle place with the testing that you were talking about with losing the Optum Serve, and I know that the messaging is going to be coming out with where people can get tested, but if somebody had to get tested today or tomorrow, where would they go?
Today and tomorrow, it's the same. The current sites are working through the rest of the week.
Oh.
So they can go to the Optum Serve sites just as we've been doing it before. And then starting next week, we're going to start this new schedule. Denise, did you want to mention what the situation was?
Yeah, thank you, Dr. Pace. I just want to clarify. The state is still paying for Optum Serve to do testing. They're just switching their model a little. Instead of the brick and mortar, it's going to be a mobile minibus and team. So we are working on the logistics with them on the locations around the lake. They will be working 5 days a week, and each day will be in a different district. So the logistics will, as soon as we have those logistics worked out, we'll send out messaging.
Great. So my last question is more of a concern. We have the fair starting next week, and it looks like the Del Norte Fair contributed to the surge that county is facing. And I'm just wondering what the safety measures are planned for the fair so that we don't get back into a bad situation with our surge.
I have not spoken with the fair about the safety measures, so I don't know, Denise or Carolyn, do you know anything, any conversations that have been
CEO
about?
Hutchinson?
Yes, I actually spoke to the CEO of the fair yesterday about this, and she told me that they're taking a number of precautionary measures. I asked her if she could be present today, but they're very, very busy getting the fair ready to go, so she couldn't be present. But she explained that they would have signage up at all gates reminding people of the need to mask and social distance. She said that they had a number of added hand washing stations, and they had hand sanitizer placed, sprinkled all over the fairgrounds. They said one of the wineries had donated some wine barrels, and they had set up stations where people could sanitize their hands and things. So they've done quite a bit more than is usual to keep people safe.
I think the number one thing that I would recommend for folks, especially if you're unvaccinated, is to wear masks if you're around many people out there, even though certainly better outdoors, but this Delta variant is so contagious that if you're around many people, even outdoors, especially if the air is stagnant, you should wear a mask.
Is there a mask requirement for an event that large?
Not outdoors. at this point that I'm aware of.
Okay.
That doesn't mean it's not a good idea.
Supervisor Scott?
I just wanted to add, I know we were talking about our children 12 and up are eligible to be vaccinated, and we have a really low percentage of children that age vaccinated. And just for an added incentive, I know Lakeport Unified School District, if your child has a close contact with somebody that has COVID and they have no symptoms and they're fully vaccinated, they can continue to go to school. So for me, that's an added incentive that my children, they're going to have close contacts going back to school, but if they're fully vaccinated, they can stay in school and just have the parents watch the symptoms. So just a good idea to get your children vaccinated if they're eligible so they can continue to go to school.
Thank you for that. Any further comments? So I did want to just make a clarification, just because I know a lot of people listen to what we are talking about, and there's a lot of changes that happen, especially changes happened yesterday. The approval of the FDA was for 16 and up for the Pfizer, but it is available still through the emergency approval for 12 and up. And so at this moment in time, the full completed approval by the FDA is for the 16 plus, and they are working on getting the Moderna, which I believe they said would be in 4 or 5 weeks possibly, and then of course going to the 12 and up as well. Also, I do want to check in on that additional vaccine, and I think there's some confusion. There's the additional dose for those that are immunocompromised, and then there's also the conversation about the booster, and I think those two are easily intertwined as one and the same. And the booster right now is being discussed about being available in fall for those that are 8 months past their second shot to possibly re-enhance the protection that the original vaccination afforded. And I'm looking at the CDC website for the immunocompromised, and it says that again, it's for the specific few that are very immunocompromised, and it says here 28 days after your second vaccine has been completed. So I just want to make sure that we have the correct information so that those that are reaching out, I've had a few people reach out to me that I've told to reach out to their primary care providers to make sure that when we get contact that we provide the information on what is possible and what is not available depending on their status. And it's getting difficult because there's multiple varieties of vaccines. There's different varieties of status of people on where they are in the vaccination, where they are in their health status. So I think there's just a lot of moving parts and information. But if we can make sure that we have that information and possibly be able to put that on our website as well to help our public find out where they can, what their status is and what they can do to enhance their protection, I think that would be great. Before I open it up for the public, just checking in again. All right, let's go ahead and open it up for the public. Anybody in the boardroom wish to speak on this item? Please go ahead and come to the microphone, and you have 3 minutes.
My question is really simple. If you're vaccinated, what is it that you're receiving? Why do we still have to wear masks?
So at this moment in time, our hospitals are absolutely overwhelmed, which means that if beyond COVID, if you have a heart attack, if you have a kidney failure, if you have any other type of ailment, there is less probability of you getting the correct care at a hospital right now because of the amount of people that are in our hospitals.
But if we're vaccinated, fully vaccinated, what is it that we're getting?
We're helping the people around us. That is what is happening. Because the virus can still come to you and me. We're both vaccinated, it would seem.
We can carry the virus?
Yes.
Is that correct, doctor?
And Dr. Pace, if you want to respond, I'm sorry if I'm responding for you.
Right. No, this is a good question because 4 to 6 weeks ago, we thought it was very unlikely that vaccinated people could get the virus and spread it. And now we're learning more and more that people that are vaccinated can get the virus and can spread it. But that's where that one slide that I showed where people are 7 times more likely to get infected if they're unvaccinated than if they're vaccinated. So you can still get infected and you can still spread it, but it's much less risk that you're going to get infected if you're vaccinated versus unvaccinated. And I think the main thing is the biggest advantage of getting vaccinated is it's very unlikely that you're going to end up in the hospital or die from the COVID if you're vaccinated. It's not impossible, and usually the folks that get in the hospital or end up dying that have been vaccinated are older folks with, not as vibrant immune systems, or folks that are immunocompromised from other kinds of issues. So your question is why do I need to wear a mask if I'm vaccinated? It's mainly to slow the spread around the community, because you can get infected, you can be contagious, and if we can slow the spread through the community, we're a lot better off.
And the second part of my question, will there be a day when we don't have to wear masks?
I sure hope so.
Yeah, we all hope so, for
Sure
sure.
hope so.
I think most likely what we're going to be seeing is that this will become a kind of a chronic illness, sort of like the cold. Once our immune systems get used to it, once we kind of are become acclimated to it, it'll be more like an annual flu or something like that, where we are dealing with it in a different way. But at this point, because it's so new to our immune systems, a certain percentage of the population just gets overwhelmed and has to go in the hospital or is dying. And so we need to take these measures to try to protect the population.
Thank you for your question, sir. Real quick, I'm going to make a pause. We have a hand up from Johanna.
Can I get the name of the sir? If he could come up and...
Oh, what was your name, sir?
Steve Estrada.
Steve Estrada. Thank you very much.
Thank you.
Anyone else in the boardroom have questions? Please give us your name and 3 minutes.
Joan Moss. I'd like to know, Dr. Pace, if you are an interim health officer or a health officer. It wasn't made clear. And secondly, I want to know where people can go to get tested for COVID. Thank you.
Thank you for your questions. Dr. Pace?
Well, I'm not working full time like I was before. I had left and been kind of helping out, but we haven't been able to find a replacement yet. So I'm basically working some here and other places as well. So it's kind of helping as best I can during this time. The question about the testing is what we were mentioning before. For this week, it's still the same setup as before. There's the OptumServe sites through your primary care provider, through some of the pharmacies. Starting next week, that'll be shifting a little bit with a mobile testing site going around the county. Still with your providers, still with the pharmacies. There are home tests available now that you can get. You can get stuff, so there's a variety of ways to do it. If that's a concern, if people are having trouble finding where to get tested, please let us know at the Mohawk line and we'll try to make it more transparent.
Thank you. Any further comments or questions in the boardroom on this item? All right, let's go to the Zoom room, phone 2689, if we can unmute. Again, please provide your name, and you have 3 minutes.
Hello, my name is Christina Robertson. Can you hear me well?
Yes, we can.
Okay. Well, I just wanted to say a couple of things, and thank you for hearing me. Well, some people have said ivermectin is helpful in stages, and that's important, that early stage part. But these people were not just some people, they were highly respected and educated MDs. So that's one thing that I just want to point out. And there are people who have had success treating their patients. There's other doctors who have had success with already approved and known drugs instead of experimental vaccines. And then another thing I want to say is, as far as studies go, there's been quite a few studies on ivermectin, and there's a website, c19ivermectin.com. 71 of them have been peer-reviewed. Now, I haven't read all these studies, of course, and don't know what the findings were, but I just wanted to point that out if anybody has that kind of inclination to look. But it does look like there's been improvement, that there is evidence of improvement through these studies, just glancing at it lightly, like I did. And then another thing that I want to say, so I had a college professor who said studies are you can get a statistic to prove or disprove just about anything you want to prove or disprove. But, who pays for the study? How many people are included in the study? There's lots of variables when you want to look at a study to prove something. And then the other point I want to make is what's bothering me the most. Okay, if you want to get a vaccine, get one. I don't want one. I don't want to put that in my body, and I'm healthy, and I just don't want to do that. So I believe I should have a choice, and people are not being given choices right now. And the thought that there's a protocol, a template in place which I brought this up last week on the cdc.gov website, a template for green camp, places to put unvaccinated people who have not complied with the wishes of others. This bothers me. This bothers me a lot, and I know it bothers other people. Okay, someone on the board said, well, just because
your 3 minutes are up. If you can give us your final statement.
Yes, just because it's on the CDC website doesn't mean they're going to put it in place, but it bothers me that it's there in writing anyway, already, that they've thought about it. Thank you for hearing me.
Thank you for your comment. Next is Julia Bono.
Hello, can you hear me, Board?
If you can maybe speak either a little louder or a little closer to your microphone.
Okay, trying to do so now. Is that improved?
Perfect.
Okay, thank you. Good morning, Board. My name is Julia Bono, and I have a scientific background that qualifies me to perform and understand scientific research. First of all, I wish to address some potentially harmful misinformation shared by Dr. Gary Pace twice in this meeting, as well as once by a board member. In fact, the FDA did not remove the Emergency Use Authorization, or EUA, for the Pfizer vaccine, as was then stated. Instead, the FDA simply extended the EUA period, which means that this vaccine is still in the experimental stage and should not be represented as safe and effective. That matter was also misrepresented to the public in the media, and most notably in the New York Times article. My point is evidenced by the FDA's own official documentation published on its website. I will send a link to the board of the official FDA document that Gary and media outlets like the New York Times have misrepresented so they can review it themselves. For others, I will quote the fourth paragraph in the FDA document, which states, on August 23, 2021, having concluded that revising this EUA is appropriate to protect the public health or safety under Section 564G2 of the Act, FDA is reissuing the August 12, 21 letter of authorization in its entirety with revisions incorporated to clarify that the EUA will remain in place for the Pfizer BioNTech COVID-19 vaccine for the previously authorized indication and uses, and to authorize use of Comirnaty COVID-19 vaccine mRNA under this EUA for certain uses that are not included in the approved BLA. So that is clear evidence that we are being facts are being misrepresented to the board. To avoid the spread of such serious misrepresentations and any official actions taken based upon them, I would respectfully suggest that any individuals who are asked to speak in an official capacity please check their facts with original official sources before sharing it before the board and its audience. Secondly, a recent study suggests that those consuming a plant-based diet are 5 times less likely than those consuming a low-carb, high-protein diet typical of heavy animal product consumers to suffer moderate to severe COVID-19 symptoms. I provided the board with a link to the most recent version of that paper. Basically, I hear a lot of official support for and even pressure to employ vaccination as a preventative measure for serious COVID-19 symptoms, despite the known health risks that include the life-threatening blood clots my own sister-in-law suffered shortly after taking the Moderna vaccine, and which was reported by her doctors to the CDC's VAERS database. I am therefore wondering what the county and the Board of Supervisors are doing to promote healthier plant-based diets among its residents that have a similar COVID-19 prevention profile and are notably safer to implement than vaccines. Thank you.
Thank you for your comment. Next is Ahava Rose. Again, please give us your name, and you have 3 minutes.
Thank you. Good morning, board. Ahava Rose from Middletown. Dr. Pace, my father is an NYU graduate, general and vascular surgeon who also participates in wound and ER care. He graduated from Princeton University in '81 and has written for several medical journals. He's also the great-grandson of a Holocaust refugees from Poland and Odessa. Could you explain to me, in your own words, your understanding of the Nuremberg Code and the ethical medical standards established worldwide?
Let's move on with the comment, please.
Thank you. Does every patient you inject know that the experimental trials aren't over until 2023? And do they know that antibody-dependent enhancement is listed on the consent form as at the very last item of a laundry list of its side effects? And how are doctors to give their informed consent, if truly informed consent, if all the injection inserts are left intentionally blank? And what is the intention behind that? And has a respiratory virus ever been eradicated by a vaccine? Being that the DNA sequence of SARS-CoV-2 has genetic elements of SARS, 2 different kinds of coronaviruses, and HIV, wouldn't you expect to treat with intracellular anti-infectives, corticosteroids, and immunomodulators and antiplatelet drugs, since viral proliferation is met with both cytokine injury and inflammatory thrombosis? First of all, hydroxychloroquine reduces viral entry. It works as a zinc ionophore, which impairs the RNA-dependent polymerase and is anti-inflammatory. There are 259 supportive trials with over 385,000 individuals showing outpatient studies that demonstrated a 50% reduction in hospitalization and death. Ivermectin also impairs nuclear viral entry and has properties against the spike protein itself. Your ABC-funded study compiled late and early treatments, and that was one study that you looked at, and I'm familiar with it. There are 70 apparently other trials that show a 70% reduction in mortality, and this drug has been available for 40 years and proven safe and effective. Dr. Jim Meehan is graduated medical school, top of his class, and is licensed in 22 different states. He's an expert in scientific research and literature, and he says that the suppression of alternative treatments resulted from medical journals colluding with pharmaceutical industries to create fraudulent research studies discrediting hydroxychloroquine, and that Bill Gates is working towards one on ivermectin. There's been 100+ years of randomized control trials showing that mask wearing promotes bacterial pneumonia. 82% get headaches, 23% become severe migraines with nausea and vomiting. Charts at rationalground.org show everywhere masks were mandated saw an increase in hospitalizations and death. And Fauci's emails even show him admitting that masks don't work. And lastly, Dr. Pace, why hasn't Pfizer's CEO taken the shot? Thank you.
Thank you for your comment. Next, phone 4627. Your name, please, and you have 3 minutes.
Good morning. This is Tom Slate, and I just had a couple of concerns. What I was hearing, apparently, and I'm generalizing here the words that ivermectin and HCQ, according to studies, don't work. And those are not the exact words. I don't recall what it is. And I'm reading so much that they do work, and a lot of other treatments, and it's even for really inexpensive treatments. So Dr. Pace alluded to some studies. It didn't tell us what they were. But I'm wondering, and I hate to make it personal, but that's who it was. So, and I'm operating in good faith. I'm sure he is too. But will he be willing to make a personal statement, his own thoughts, his policy, and maybe even medical advice as to whether these things, maybe people shouldn't be taking them. But anyway, his position on, I'll just say ivermectin and HCQ, his own personal thoughts on that and his position on that. So that would be very helpful. Thank you.
So I'm going to allow Dr. Pace to respond to that, but I do want to say Dr. Pace will not be the doctor in the ER room who makes a decision of what pharmaceutical drugs are required to care for you. He is also not your primary doctor who will go ahead and prescribe you what you need for the best care. And Dr. Pace is also not ordering hospitals to ignore any possibilities of any healthcare solutions when it comes to COVID-19. From what I understand and know, Dr. Pace is conveying information that he has been provided and researched, and trying his best to keep us up to date on what is happening with COVID-19 and how to best be cautious in the unfortunate situation that we have to deal with. And Dr. Pace, I'll let you respond.
Hi, thanks. Yeah, you know, I'm a primary care doctor. I do take care of patients, and I see people a lot. And the way we make these decisions, so you're kind of talking about specific patient treatment for sick people. That seems to be what a lot of the focus is here. What I've really been talking about through most of this is kind of a community-based approach to how to slow down the pandemic and how to prevent people from getting sick so that they don't end up in the hospital. But when I do take care of people, as a doc, we use this sort of pathway of looking at medical studies, clinical studies, and you know, it's a very imperfect science. We're always trying to weigh and balance risk versus benefits, and what the most of the studies have been showing that have been done, the kind of the quality I'm used to thinking about, have not shown benefit for hydroxychloroquine or ivermectin. And there's been a lot of interest in it. There seems to be a lot of interest in the alternative community, but the conventional medical community has done some studies on these and have not seen the kind of effects that we need. But again, as Supervisor Sabate was saying, you know, I'm not prescribing for most of those people in the hospital that are sick. There are some things that have been shown to be useful. The monoclonal antibodies, remdesivir, some of those show some benefit, but it's not huge benefits, but they do help at certain stages. And then, yeah, if people get sicker, it's you're looking at steroids and other kind of immune modulators. But so I think it's, you know, there's a way that we look at things in the medical community that tries to understand what shows benefit and what doesn't. And these things have been studied, and they aren't rising to the surface as ways to really show positive impact. But and I think the preventative questions of a good plant-based diet and all that, I think those are great ideas. I would totally encourage that. But once somebody's sick, you know, then it's a different story. So I think the main thing is whatever people end up choosing to do or what their beliefs are about this, I just want to really encourage them to, some of these things have been proven to benefit, and I would encourage people to use those.
Thank you, Dr. Pace. Phone 6205, please provide your name. And you have 3 minutes.
Good morning. Can you hear me?
We can.
Thank you so much. I'll be very brief. I've been monitoring you both on Zoom by phone since the beginning of the meeting and Zoom online. And I just want to make sure that you know that on Zoom online, the meeting was not up and running until 10:13. So from 9 to 10:13, the meeting today has not been available online.
I'm not sure what you mean, since I've been watching the attendees and the list has been pretty packed with people. I'm not sure if you mean Facebook, but
yes.
Well,
yes.
Facebook is an extension of what we do. Zoom and in the chamber is the main place that if you want to communicate with us, you can communicate. If you just want to watch us, we will be absolutely posting the video, as we always do, both on Facebook and on our website. So please continue with your comment. Thank you.
Thank you. That's the body of my comment.
Appreciate it. Thank you. Next is phone 1113. And again, please provide your name, and you have 3 minutes.
Yes, hi, this is Dr. Will Tuttle. Okay, I'm speaking on behalf of the thousands of people here in Lake County who want to take responsibility for their own health and who don't trust the criminally corrupt pharmaceutical corporations who have immunity from any prosecution for the deaths and the injuries that they're causing us. The only immunity in this is for the pharmaceutical industry. The people who are getting vaccinated are getting sick and dying at unprecedented levels, and you are all deceiving us and are part of the criminal agenda that is happening throughout California. Amid this nonstop storm of fear porn that you and Big Pharma are spewing, I would like to say something positive, that we can take responsibility for our health and celebrate our lives on this beautiful earth and not be afraid of each other and not be afraid of germs. I wrote a book called The World Peace Diet, and it became a #1 Amazon bestseller worldwide back in 2010, has been published in 17 languages. I've traveled all over the world.
If we can prohibit from shameless plugs in your public comment, that would be great.
No, I'm saying that the basic idea in this book is that when we take responsibility for our health and treat each other with kindness and love and celebrate our lives with creativity, that we'll be healthy, and that fear and exploitation and violence and toxic poisons are what make people sick. I've traveled all over the world, to China, Korea, Southeast Asia, Middle East, Africa, Eastern Europe, Western Europe, South America, and all 50 states, spreading this message, which is a wide message getting to more and more people. And with all this traveling, I've never gotten sick in the last 50 years. I've never been to a drugstore or had a prescription drug of any kind in the last 50 years. No need for aspirin, Tylenol, Viagra, Right Guard, Rolaids, prescription medications, all these other poisons that people are indoctrinated into buying. So if everyone did like I'm doing and took responsibility for their health, Big Pharma would be out of business and we'd be free. The problem is that people have been brain poisoned and not taking responsibility for their health. And that's causing tremendous sickness everywhere. That's the most important thing, to realize that when we eat an organic, whole food, plant-based diet and do our best to minimize the suffering and exploitation we cause to cows and pigs and chickens and fishes, and when we eat organically grown food without pesticides, herbicides, and fungicides, we can create a wonderful foundation for health for ourselves and for everyone. Compassion and joy are the pathways to health, not the fear, cruelty, and violence promoted by the medical pharmaceutical food complex. Additionally, we are called to cultivate healthy, positive, loving relationships, as well as the mental attitude of joy and gratitude every day, and live a life inspired by a purpose to help make a better world. These are the keys to radiant health that real doctors and real supervisors would be recommending. And exercising creativity in our life, then we're creating a beautiful life that will spread love and health to everyone. That's what we should be focusing on, not all this fear that Big Pharma is propagating. That's how you get people sick, through fear and through recycling and breathing in our own exhaust and getting hypoxia and brain damage and lung infections from these ridiculous masks and the lockdowns and the toxic poisons in these vaccines.
And your 3 minutes are up. Thank you very much. Next is Amanda Brock. Again, please give us your name in case that's not the correct name, and you have 3 minutes.
Hi there.
Oh, we got a problem here. I don't know if you have 2 speakers going on for the meeting at the same time.
That may be a Zoom crasher, Mr. Chair.
What was that?
Might be a Zoom crasher.
Your Zoom crashed?
That may be a Zoom crasher, is what I'm saying. That may not be a real comment, I'm not sure.
Okay, let's, if it's possible to see what's going on with that one, let's go ahead and move on to phone 6478. Matthew, if it's possible for you to try and work with Amanda, and let's go with 46478.
Can you hear me?
Hello.
Let's go ahead and mute Amanda Brock, and we'll come back to Amanda Brock. It looks like she was able to get some sound, and we want to make sure to get her comment, but let's go ahead and move on to phone 6478.
Amanda Brock is also a Hava
so
Rose
that's me.
who already spoke.
So,
Ahava Rose and Amanda Brock are the same person.
Okay.
There is a lot of people talking, so can I talk now?
Yes, now it is your turn. Sorry about the confusion.
All right. Good morning, everybody. And my name is Madeline Bueller, and I like to talk about, first I like to thank you, Steve, who spoke up. It's very important that we speak up, and it's maybe not exactly targeted to the supervisors and the whole board, because you have your agenda and you have to follow this. But the listeners who listen in and are on the verge of not knowing what to do, or are on the other side of the mainstream indoctrination. So that's why I'm speaking up here. And I like to say that it needs at least 12 years to approve a vaccination. It needs a lot of tests and everything. And so now they approved it just within a few months, and the Pfizer vaccination. And I think nobody should take it. I mean, that's not, I mean, it's like totally not good. And I like to repeat myself about this hydroxychloroquine. Like the medical doctor, MD, a real MD, because I know you like to hear that, it's Vladimir Zelenko. He has 99% success in treating the people with this. And this is a benevolent drug, if one can say it like this. It's not like a vaccine one doesn't know what's in there, and very toxic. So I would kind of like see this more publicized in your board. Then also more effort to lower the cases of death, of cancer, diabetes, heart diseases, and all that. Nothing is put in for that, no effort. And I know why, but, you know, it's, of course, it's the big pharma. And it's money. It's all about money. So vaccination is not the key. You mentioned that vaccination is the key. That's not the key, according to what I said before. And so, yeah, I hope everybody is well, and all that masking and everything gets out of the way, because it doesn't work anyway. Fauci said it in the very beginning, that it doesn't work. One has to wear 10 masks over each other, and you can imagine how we look.
Your 3 minutes are up, if you can finish your comment.
Okay, thank you. I'm finished.
Thank you very much. Let's do Amanda Brock, since we had a little confusion there. Let's see if we can get the sound going.
Hi, can you hear me?
Yes, we can.
Okay, thank you. That's working better. So, Dr. Pace, I just am curious what not fully vaccinated encompasses. I have some questions. If I were to want to get the Pfizer doses, and I wanted to know what the ingredients are, are you familiar enough with them to tell me what is SM-102? Could you also sign a liability form for me, accepting responsibility for medical bills if I were injured? I also want to know, do you know about Chantix is a drug made by Pfizer, and it, I believe it was approved in 2006 by the FDA, but it's recently been linked to cancer. And I think that was after 15 years of FDA approval. Another thing I want to know is, can you produce an analysis on your own of more than 5 different ivermectin studies for next week, if that's a possibility? I'd like to get a broader idea of what the rest of the studies say. Do you also have any more trust in acquired and natural immunity? I think it's really important to boost our immune systems at this time, and I've been following a nuclear cardiologist and physicist in JD, Dr. Richard Fleming. His website is theflemingmethod.com, and he has a lot of prospective studies on his website that look like they have a really positive outlook for various kinds of treatments that have worked and have saved people's lives, so that we can go through this without having to put chemicals that we don't know what they are in our body. That's all. Thank you.
It would be very easy if you had the same name rather than logging in as two different names. It seems a little deceiving and deceitful. And your questions, I will go ahead and answer some of those questions for you. Dr. Pace, feel free if you want to respond. Just look at the numbers of what's happening, okay? Yes, there are chemicals in the processing of creating pharmaceuticals. Absolutely, 100%. It is not just an apple off a tree that's going to solve your problem. But look at the numbers. Go into a hospital and see what's happening. Nobody that works in a hospital is having a fun time right now. And a large majority of the people that are finding themselves in the ER are due to shortness of breath, and there is no coincidence as to why that is the case. And it happens to be that those who are unvaccinated are the majority of those cases versus the vaccinated, meaning the vaccination is working. At this moment in time, myself and the board are not forcing you to take the vaccine. The questions, you can have those questions all you want, but the fact of the matter is the data shows that it is helping. And that's what matters. We need to do what we can to help our community. 3 people died over the past weekend. Those people were unvaccinated. So you can be as deceitful as you want by logging in as Ahava Rose and Amanda Brock and changing the speed of your voice and not have the actual goal to come and see us right here in the audience and hide behind a screen. But please, come on. That's childish. Dr. Pace, if you want to respond.
Well, you know, I mean, I think really from my point of view, what we're trying to do is to save lives and to keep people as healthy as possible. And a lot of the preventative stuff is a great idea, but we're in a different situation right now, which is a pandemic. And so, you know, any medical intervention does have risks. So the vaccines, there are some risks for sure. And but when you start looking at the benefits versus the risks, it's clearly prudent to go ahead and move forward with these things. And, you know, so I'm not sure why folks are so invested in kind of this challenging me to take personal responsibility for things. It's, or to kind of spread this, this other kind of information. So it's confusing to me why people are so invested in doing that. But all we can do is just sort of try to roll out what we think is the best thing and how to minimize risk. So yeah, that's all I have to say. Thanks.
Thank you, Dr. Pace. All right, I see no further comments in the Zoom room or in the board. Anything from the board members? Supervisor Peiska?
Yeah, I want to follow up on what you were saying, Supervisor Sabatier. This isn't fear-mongering. 3 people died over the weekend, and those families are mourning, they're suffering, they were members of our community, and they were unvaccinated. And this is real. And this is about taking care of our community. Please do not minimize these deaths, because we feel them. We all feel them.
Supervisor Simon?
You know, as been stated many times by myself and the board members, what we're attempting to do is provide the information so you can make your individual decisions. We understand what is going on. The pandemic is real. We are having loss of life, and we're attempting to do everything we can to put the best decision in your hands. This information that we bring forward, will continue to do it. We know there is going to be opposition. You know, individuals want to make their own decisions. We are at the point in this pandemic right now that we know there is an opportunity with the vaccinations to limit the sickness. If you are going to be infected, even if you are vaccinated, it limits your opportunity to be hospitalized or death. And we're going to continue to press this message as much as possible. As Jessica and Supervisor Sabatier said, and the rest of us, so that would put us at 70 at this point. We're at 67, 72 deaths here in Lake County. And we're going to do everything we can to provide the information for you to make a decision. We've said it before. If you are not going to take the vaccination, please wear a mask. Do your part to help the other community members if you make that decision. And we'll continue to push this on. There is no big pharma agenda. This is not something any of us could foresee as we took our positions here as supervisor, and we're going to work hard to just continue to provide the information. As you know, we have other subjects on this agenda. We are going to try and give you an opportunity for testing, vaccinations, if that's your choice. If not, we'll hopefully help implement other conditions that will help stop the spread of this disease. It is happening every day. It is affecting businesses, families, every day. As we sit here, there will probably be more that happen this afternoon. So we're going to continue with that message. We appreciate everybody. I've never heard this board shut anyone down. You can have your opinions. You're able to do that, and we'll continue that opportunity for an open conversation, even if we do not agree with you. But we will not sit here and be berated that we are bringing genocide or other things like that have been said, and it's absolutely ridiculous. So that's what I have to say.
Thank you, Supervisor. And with that, thank you very much, Dr. Pace, for that presentation. So I know that we have item 4.2 that is related to public health. If you don't mind, Dr. Pace, I'd like to take 5 minutes. We have some people in the audience who have been waiting very patiently for a proclamation. I'm going to go through that proclamation over the course of the next 5 minutes, and then we'll go ahead and hit up item 4.2. Is that okay with you, or do you have to be somewhere momentarily? Okay, I got the thumbs up. So let's go ahead, and we're going to move on to our 9:40 item, presentation of proclamation designating Tuesday, August 31st, 2021 as International Overdose Awareness Day. And it seems I have a team with me, if you guys would like to come up to the front. International Overdose Awareness Day 2021. Lake County Behavioral Health Services and Lake County Health Services recognize Tuesday, August 31st, 2021, International Overdose Awareness Day. Whereas International Overdose Awareness Day is recognized globally on August 31st to raise awareness about the risks of overdosing, honor the individuals whose lives have been lost from overdosing, and acknowledge the grief felt by families, friends, and communities. And whereas International Overdose Awareness Day aims to publicly challenge the stigma associated with substance use disorders and overdosing. And whereas in 2019, over 6,000 Californians died from a drug overdose, according to the Centers for Disease Control and Prevention. And whereas every person deserves our best efforts to prevent injury and death from overdose, and it is imperative to support overdose prevention policies and projects and to help make sure everyone understands overdose is a social issue which impacts the victim, families, friends, and communities. The County of Lake Board of Supervisors, Lake County Behavioral Health Services, and Lake County Health Services urge all residents, parents, public, and private organizations, hospitals, schools, and colleges in Lake County to support efforts that will increase community awareness, understanding, and action to address drug overdose. Now, therefore, the Board of Supervisors for the County of Lake join with the Lake County Behavioral Health Services and Lake County Health Services Departments and do hereby proclaim Tuesday, August 31st, 2021 as International Overdose Awareness Day, passed and adopted this 24th day of August 2021. And thank you all for being here. Your shirts remind me of the importance of what we have changed in the last few years, where now we have our EMS teams, our firefighters, and many of our law enforcement that carry naloxone with them, a life-saving drug that brings them back so that momentarily we can get them to a hospital where they can get the care that they need. It does not solve their problem, but it gives them a chance. It gives them that second wind. And it has saved lives right here in Lake County. I'm very proud that we've implemented that here. So if you would like to please speak on this.
Hi, my name is Anina, and I'm the founder of Any Positive Change, and that's a lovely proclamation. Why, thank you, sir. And I want to say that drug users are truly the first responders. They are the ones who save each other's lives. And we have been dispensing naloxone under a standing order now, but in the beginning, a little, since 2008, when we found 2 of our very savvy drug users dead. The CDC estimates that in 2020, 90,000 people lost their lives to opiate overdose. So it seems like the theme is preventable death and pandemic, and opiates, the opiate epidemic is a pandemic, overdose is preventable death. And so I'd like to encourage everyone to get trained on carrying naloxone. It doesn't require a whole lot of smarts. I have it in my pocket, I have it in my purse. And we train drug users to, free of charge, to have naloxone and carry naloxone. And we can document hundreds of opiate reversals. So thank you so very much, sir, and all of you. Is this mine? Woo!
And then I do want to add, and then I'll let Supervisor Scott add something. We are also, unfortunately, this is the importance of this proclamation. Last year in our... Are we having an emergency, or is there just a technical problem?
Also, Sheriff's alert in Kelseyville, downtown to be evacuated.
Downtown Kelseyville?
So we will finish this later. I'm going to take a break.
Thank you, sir.
5-minute break. We got Dale back.
Dale's
So the
back.
OES
Dale is.
manager is here.
Dale's
Dale,
back.
are you hearing?
5-minute break.
Dale? No. Okay.
Yeah, we are taking a 5-minute break, and then we'll continue and finish this up, but I know Supervisor Scott wants to say something.
It's not on watch duty.
Check, check. All right. Let's go ahead and reconvene. Sorry for that interruption. So we got a faulty emergency signal from someone's phone and thought that there was something going on locally, and so we wanted to take a break and make sure we checked on it, making sure not to ignore any potential emergencies if they did materialize. But nothing is happening. That was an old emergency call. So let's get back to what we were doing. I believe Supervisor Scott, you wanted to make a statement based on our presentation.
Yes, just wanted to add that being trained with NORCAN is definitely something each and every one of us can do. It's free here in the county. You can approach the SafeRx booth at the fair in a couple weeks, and they can train you on how to use NORCAN, and you will actually leave with a kit. So you can too save a life if somebody does have an overdose. I took my teenage kids down to get trained with NORCAN, and it was great information for them because it's not only how to use the drug, but how to avoid an overdose and how poisonous these drugs can be. So it was great training for my children. And also they'll be training on August 31st at Lakeport Library Park all day, starting at 10 o'clock. SafeRx will be there to train anybody interested in how to use NORCAN.
Thank you very much. And we have Director Metcalf with us from Behavioral Health.
Oh, I'll be brief. This meeting has gone on for a while, but I just want to thank you for allowing us to introduce this proclamation today. And, you know, as the proclamation states, International Overdose Awareness Day recognizes and spotlights the need to continue working to educate folks on overdose prevention and harm reduction. And I do want to give a shout out to all of our community members who work tirelessly to help put an end to substance abuse. And as was stated also in the proclamation, this is kind of a joint effort between Behavioral Health Services and the Health Services Department. And I know there are a couple other folks from the Health Services Department that have more to share about this. So again, I promised to keep it brief, so I will hand it off to Health Services. I think Kim Tangerman might have something to say.
Please.
Morning. Good morning. Thank you, Todd. Yeah, we had a brief video to show you. Hannah, was there a chance to play that real quickly?
Yes. Are you able to share? There you are.
That's in the share screen.
Oh, we are not getting the sound that we wanted. And Matthew, you're muted. Maybe that's the reason why the sound wasn't coming through.
Yes. Were you getting no audio at all from the video?
Yeah, no audio at all. Let's try it again.
Let me try again.
Yeah.
Hello, my name is Bob Gardner. I appreciate you allowing me to do some public relations work for addicts and alcoholics. My credentials, I've been a California physician for 47 years. I've lived and worked in Lake County for the past 22. Over the years, I've been medical director of many of the social model and medical model programs in Marin, Sonoma County, and County, and Lake County. So I've been able to follow substance abuse issues in our county for the last 47 years, because that's where people would end up. Currently, I run the substance abuse program at Adventist Health over in Lucerne, and we get a lot of the referrals from the 2 emergency rooms. I'm also medical director of Hilltop Recovery, which is the only residential program in town. My mission today is to help our community leaders see the suffering human being when they look and talk about addicts and alcoholics. Addictions is an equal opportunity disease. It's just not in our lower socioeconomic groups. I've seen people in Marin, Beverly Hills, where they put Mercedes convertibles and thriving businesses in their nose and in their veins. It's a disease that affects almost every family in our county. Every family has an uncle or a child or somebody who's an addict or an alcoholic. So it's not just the ones who have the disease, it's everybody around them, including neighbors. This is something that's out there. It affects just about every family. I've treated a lot of the families of the community leaders over the past 47 years. So it's something that people may not want to talk about, and it's not a strong voting bloc, but each community leader represents the recovering addict and really all their family. The biochemistry of addiction is related to the neurotransmitter dopamine. And this is a neurotransmitter that is essentially in charge of motivation. It helps you get up, it helps you find food, it helps you reproduce, it helps you get a place to live. If your dopamine is low, you can't get out of bed, you have no motivation, you just feel flat. That's that term. So what happens when people use, most of the drugs are going to elevate dopamine. Things like methamphetamines can raise dopamine levels 20 times normal. So you can see the attraction there. What happens though on subsequent uses, that dopamine level keeps going up, but nowhere near where it went up the time before. So it might be 90%, 80% of where it was the first time. Eventually, a person gets down where it may be 10, 20% below normal. So unless they use to get that dopamine back up, they're sick, they're exhausted, and this is where the craziness starts. This decreased dopamine level is when a using addict will rob our house, take our TV set, go crazy, and be hustling in an emergency room. This is where they'll sell their mother's jewelry, because they're not necessarily trying to get high. They describe it as getting well, and it corresponds with their dopamine. So emergency room and doctors' offices often see this desperate behavior of the dopamine lack. This lack makes people feel there's no way out, and this is why some of the craziness happens. But I think it's important to realize they're biochemically sick, and they deserve that. Each addict you see is somebody's kid. It could be somebody's parent, brother, sibling, neighbor. Think it through. It could be us. It could be. It's a disease that affects all varieties of people. Sometimes we have genetic predispositions, so some family, instead of running high in heart disease or high blood pressure, they have a large component of family members that have addiction and alcoholism. Sometimes people, like some of our veterans or people who get in accidents, are started on pain medicines by doctors, and that gets their addictions going. Some drugs are so powerful that you use it a few times and then you're addicted. The good news about substance abuse and addictions is that people can recover. They can become doctors, lawyers, counselors, and even politicians. So I think that as politicians, it's good to remember that there's a large silent voting bloc that you represent, and they deserve respect and caring. I think as we treat addictions better and better, our health dollars will go further. And I think the human suffering will decrease. I was on an economic group 20 years ago for Lake County. One of the biggest things was the concern about drug addiction, and we kept some businesses out of the area. So I think by recognizing the problem, giving it courtesy, we're going to help our community in a lot of ways. When people come to my office, I do the doctor things. I listen, I poke them, I draw blood, I order medications. But I think the most important thing I do is let these people know that I see them as a person, that I respect and care about them, and they can keep coming back until they're better, that there's hope, and that we are concerned about them. For those who have drifted off, these are the closing statements. My request is that you, our elected officials, understand the biochemistry behind the changes in these people that we call addicts, and that we see the human being in the suffering addict and treat them with love and respect. Thanks for your attention.
Thank you for that. And I see that Kim Tangerman has her hand up.
Yeah, that was just for the audio part of it, but that's okay. I can take that back down. I just really wanted to thank Dr. Gardner for his willingness to make this video and for his expertise and his compassion. I also wanted to recognize the work that SafeRx and the Leave It Behind program are doing, as well as any positive change. Getting the naloxone out there is just so important right now to our community, and they're working tirelessly to make sure that people are trained. I'd also like to invite everyone to the International Overdose Awareness event that's on August 31st at Library Park, where we will have a lot of tabling going on from different agencies, and we really seek to reduce the stigma around substance use. Thank you.
Thank you so much. Any further comments from the board? Let's go ahead and open it up for the public. Any comments on this item from the public? Please come to the microphone. And if you're in the Zoom room, please raise your hand and we will call on you.
Joan Moss, I would like to know the name of this material or drug that people suffering from overdoses are given that saves their lives. I didn't hear that, and I didn't hear it spelled. Thank you.
Naloxone.
Could you please spell that?
Naloxone. Naloxone. Let me look it up.
With the t-shirts left.
Yes, Naloxone.
Nallos.
Naloxone. And if you didn't get that,
XOND. Thank you.
If it doesn't work, talk to me afterwards. All right, let's go ahead and bring it back. And thank you again for that presentation and the proclamation. Both departments working together, really appreciate it. And I do know of the hardship that you face when dealing with this issue in our community. Unfortunately, it's not one to brag about, but the County of Lake did have one of the highest overdose rates in the state of California. And so definitely something to pay attention to and something to look at taking action against. So thank you again. Okay, moving on. Let me get off my Google search for naloxone. And we are on 6.4, Dr. Pace, I lied, that was more than 5 minutes. But I see you are still here with us. We are going to take up item 4.2, which was approved as an extra item, and this is consideration of agreement with OptumServe mobile vaccination van and team. And I see Director Pomeroy is also with us as well.
Thank you, Chair Sabatier and Supervisors. So the Health Department team here has been working with OptumServe, of course, now for a while on our brick and mortar type of events. We were notified a week ago that the state was no longer going to pay for the vaccine piece of those sites. They would continue to pay for the testing sites, as I had mentioned earlier, on another item. While we've been working with the vaccine team at the state, we had a meeting with them again on Friday. We had a meeting with them a couple days a week, and we had put in a resource request to get a mobile team here. And that request was approved late Friday afternoon, and in order to get them here by Monday, we needed to get this approval through with your board. The team, they would be coming in. It's a team of 2 nurses and a support person. They've got a minivan. We at the health department supply the vaccine to them, so there still will be interaction and oversight from our vaccination team here at the health department. In addition to that, they're scheduled to be here on 8:30. They will do like a dry run day here at the health department so we can make sure we have everything in alignment for them to start their processes. Then they will be at the fair for Thursday, Friday, Saturday, and Sunday. They'll have a couple of days off, and then there will be a mobile schedule set up around the lake. So our intent is that they're in a different district at least 1 day a week to support the mobile community needs. They can do 2 different locations in a day, but it's that 8-hour day. They cannot do split shifts, like work 4 hours in the morning and 4 hours at night. But like in Clear Lake, they could be at one side of Clear Lake for 4 hours, take a break for their lunch, move and do another 3 hours at somewhere else. There's a whole scheduling process we have to go through with them, but our request is in order to keep to make our vaccination piece go mobile so that we can get the vaccine out into the communities. This request is being brought before your board for review and approval. The cost is just a little over $5,000 a day. They have the capacity to do 100 vaccines a day. We can schedule with them every Monday for the following week. If we want to change a location, we have to give them 72 hours. The total cost that we're asking for right now to start this and get it moving for the next 2 months is $200,000. And we're asking if that can come out of the ARPA funds to support the community COVID-19 vaccination outreach and response. And Dr. Pace may have more to give you on that. I did email you their cost breakdown, which I received late yesterday. So you guys should have that in your email. We have not received the actual agreement yet or the MOU. We're still working with that to get that. And so we're asking your board to give CAO Hutchinson approval to sign that when it comes in.
Thank you very much for the presentation. Any comments or questions from board members? Supervisor Pyska? Supervisor Crandall?
I don't know. I think I didn't see in the vaccinate or the memo, is it Pfizer or Moderna, do we know? Or are we looking at that yet? Or we're just looking at having this budget?
We're asking for both, but we're really trying to concentrate on Pfizer so we can get the age groups from 12 and above.
And that way you just do the one shot and not have to follow up with the second in case people don't take. Okay.
That would be J&J, and there was no mention from them of doing J&J.
Okay. And so I'm just wondering only because we're going to have to schedule those second vaccinations. Just want to make sure that they don't get done one time and then nothing happens, if that makes sense. But I'm just asking, that's all.
No, follow-through is important, so I appreciate the question. Supervisor Pyska?
And that's why we're asking for 2 months, Supervisor, is because we want to make sure those second injections happen back at the same location where they received the first one.
Thank you, Denise.
You're welcome.
My question is about, so you'll be doing vaccines and testing simultaneously on the same days, or is it going to be set up for different services for different days?
Right now, we're still working out those logistics, and so those details have not been finalized, but the thought is that we would be rotating, and vaccine would be at that site one day and then testing a different day. They're very separate teams. They're not the same teams. So we have to make sure they have enough space, bathrooms, all their supplies that they could do to do it mobily.
Any further
I don't know if Carolyn is on here or not, but Carolyn and Emily have been working, and myself have been working with this team. But Carolyn and Emily are really trying to work out, and Dean are working out the logistics of this.
And I do not see them here. But we do have a question from Supervisor Simon, or a comment.
Yeah, a little bit, a question. Just want to clarify, obviously understand that it's coming from the American Rescue Plan funds, and this is an allowed expense, correct, Carol? This is exactly what these funds can be used for. I just want to clarify that for everybody. This is exactly what some of the ARPA funds are to be used for, to bring and help enhance the opportunity for testing, vaccinations into the communities that need it the most. And some of the folks, we've talked about transportation issues and others, and this is just one more step in that opportunity.
That's correct.
I know I
It
could
is an
answer my
allowable
own
use.
question, but I wanted to clarify that this was, not a request out of ordinary. This is exactly what these funds are to be used for. Secondly, I guess the question would be to you, Denise, obviously talking about communication. We know that folks, every time we have an update, we are constantly talking about the opportunities where they can get vaccinated or get tested. And just want to make sure that we have a very good communication opportunity out to our communities, both on any county websites and other areas. And I am much appreciative of the conversation happening. And like we said, so it'll be hitting every district throughout the week from my understanding and what we're talking about today. And I think that is what we need to do to bring these to the people. So thank you. And I guess my question is, do you have a communication plan to get that out to everybody?
We are working with Matthew and the 3 agencies that we've contracted with, preliminary to get a communication plan out as soon as the logistics are nailed down.
Thank you.
Any further comments? So I do have a slight hesitance for this item here. $200,000, it seems to me that because you pay people for the day's worth of work, but for example, they may have just done one vaccine. I'd like to have a way to obtain the data of how much are we actually getting out of this, because if we're spending $200,000 and only 10 people got vaccinated, it's just not worth it. And I know that that's probably not going to be the case, but we have opportunities in our community to get vaccinated. I want to make sure that we have other opportunities, but I also want to make sure that we're not just spending money on something that's going to cost us $200,000 for just a very meager amount of vaccines, when maybe we could have done that in a different way to get those vaccines to the people. What is the Is there any checkpoints during this 2-month period? Because again, it's an expensive amount for just 2 months worth of work. Yes, if we could do 100 vaccines a day, I think that's absolutely worth it. But if it's going to be 5 to 10 a day, I don't know that that's actually worth it versus working specifically to try and get to those 5 or 10 people. I don't know. I'm concerned. We have the money, but just because we have money doesn't mean we have to spend it unless we actually get something in return. So kind of curious if there's any checkpoints where we might be able to check in, look at the data, and see if we want to continue, versus boom, we're done, we spent 200 grand.
So we already have a weekly meeting scheduled with Optum that we've been doing throughout the response. That meeting will continue, and that is the exact purpose of that meeting, is to make sure that their needs are being met, but also it's serving, continues to serve the purpose of the intent of the board.
Okay, and in those meetings, because you say you want them here by Monday, is there a plan of where they're supposed to be to start the vaccination, or is that when the outreach and the plan to go out starts? Because it just feels like it's very short notice, and I'm not aware at this moment in time of any plans to for a mobile unit to go around. That's kind of similar to the question that Supervisor Simon had about the communication, but I just want to make sure again that we don't have a week's lag of time where there's minimal activities because nobody knows about it or is not as aware about it. Again, it's just I'm looking at the number for the short amount of time and just a little concerned.
So Mondays, we have a clinic here at the health department, and they will be coming in to do that clinic here at the health department, which will allow us to make sure we have everything in line for the fair. Then Thursday, Friday, Saturday, and Sunday, they will be the main vaccinators at the fair site. And then that gives us the beginning of next week to get the message out for the rotation of the mobile van the next week following.
Okay. And then Dr. Pace, you spoke about Farmworker vaccine program or something along those lines. Sorry for not using the right terms. Is that something that this would be utilized with?
Well, this is the farm worker program you're talking about is this week, so it's this Thursday. We've already got that set up, so this predates that this mobile site coming in. But it's certainly something that could be part of the plan in the future. I think it's, I think really from my point of view, partly what we're talking about here is trying to really activate the demand in the county and trying to get people vaccinated now before the winter. And in this way, by getting a very robust program and getting it moving around the county more, we are going to have the capacity to vaccinate people. Now it's going to be up to us and all of our partners to really generate interest in folks that are unvaccinated to try to take the next step and to try to get, because if we could get, we've got something a little over 50% of the eligible people vaccinated now. If we could get that up to 70 or 75% by winter, we would be in a lot better shape in terms of protecting the capacity of the hospitals, preventing severe illness and death if and when the next surge comes. So I think the thinking here is to really try to get something really solid in place so that we can really start trying to encourage people on a more robust level to get moving forward with this, especially the schools.
And at this moment in time, you said that the agreement is being worked on. If we approve today, we approve for the conversation for the agreement to begin, or we approve and you sign the agreement and it gets started? Because I am also a little concerned that I don't see the agreement in front of us, and spending $200,000 without an actual agreement, which is basically a contract, I'm slightly uncomfortable.
I haven't seen it yet. I did get the cost proposal, and we have asked for, and I'm not sure, Supervisor or Chair, if it's an agreement or an MOU, or if it's just a resource that the state has allocated that that we're going to be responsible for paying for. So we're still working with them on some of the logistics.
Okay, and I believe CAO Hutchinson had something to say. You unmuted. If you can mute your Zoom.
It's unmuted, but okay. So I was going to suggest that the hope is that this service would start on Monday, but you do have a special board meeting on Tuesday. What if this service started after Tuesday? And then we could bring the agreement to your board on Tuesday, so you can look over the agreement, because it is a considerable amount of money. It's certainly a service that I think we want to offer, and I believe I was told that it has the potential capacity for up to 100 shots a day. If it could operate at that level, it probably would be cost effective. That would certainly be the hope over the 40-day period that it would be in the county. But if we delayed this by just a couple of days, then it would give your board the opportunity to see the actual agreement.
Ms. Grant?
From a legal perspective, that would be wise because the delegation...
Microphone, please. I don't know if you're not speaking into it or...
Hello?
We killed your microphone.
From a legal perspective, that would be wise because the delegation should not be vague or generalized. It does need to be specific. Your board can delegate your authority in more of a ministerial capacity than a discretionary one. So it's always better to have the parameters of whatever authority you're delegating very clearly spelled out.
And if you act in that way, then today you would be giving conceptual approval to use the ARPA funds, but then you could approve the contract on Tuesday and have the service start shortly thereafter.
Okay, I thank you for that. Any comment from that, Supervisor
My only
Scott?
comment was to make sure that we would still be able to be at the fair, because that is going to be a big event with many people will be able to get vaccinated. So I don't want to delay it and not be able to have this mobile van at the fair.
Any other comments from board members? Okay, let's go ahead and open it up to the public. Anyone have any questions or comments about this item? Seeing none in the Zoom room and seeing none in the boardroom, let's go ahead and bring it back to the board. I personally feel more comfortable, but I also want to ask Director Pomeroy and Dr. Pace, what is the possibility of what was offered to start as of Tuesday? Does that cancel every possibility of them coming here? I'd like to know what the repercussions of our potential actions, what they could be.
So what we'd ask them to do is start on Wednesday. They have to have 2 days off in a row and with a 5-day work week. So the thought was they would come Monday, get the lay of the land, look at the fairgrounds, provide vaccine here at the health department, have Tuesday, Wednesday off, and then work 4 days for the fair. But we can ask them to just come on Wednesday and do the same thing that they would have done on Monday on Wednesday.
And is anything signed for them to be here on Monday? Because no. I wouldn't mind spending ARPA funds to pay them for the day to at least come and see the lay of the land and to set up for this, because at that point that would not be an arm and a leg. And then review the agreement and then move forward with either the agreement or whatever it is that we decide to do. Do you think that would be possible? That way there's not a delay in their process? Because I agree with Supervisor Scott, but also I don't want to put ourselves in a situation that is not necessarily the exact position that we want to be in.
There's nothing been signed. That's way above my authority, so that's why it's here before your board as an extra item. And I think in working with them over the last several weeks, they are going to prefer doing the Wednesday through Sunday. Okay. They really like the 5 days in a row with 2 days off. So I can reach out to them and check and try to get back to your board before your board closes today, if you would prefer that. Otherwise, I would take Carol's recommendation and move forward with it starting here in Lake County on Wednesday and being at the fair Thursday through Sunday.
Okay, CAO Hutchinson?
Yeah, I just wanted to pose a slight alternative to my earlier recommendation, and that would be, as you know, department head or myself have authority to approve up to $25,000 worth of service without coming to your board. And so what I would recommend in order to get them here and get started is that Denise or myself could approve a couple of days, and then you can see the agreement for the longer haul on Tuesday, the 31st, and make your decision about long-term. How would that be?
And that somewhat parallels my thought for the Monday, knowing that it would only cost a certain amount. I know we have it on a day-to-day basis what it would cost, so yes, I would agree to that.
Yes.
It looks like everyone else is agreeing to that. I do have one final question. Will the agreement be ready to go on Tuesday? Because I know sometimes there's some back and forth, and it doesn't always happen in the snap of a finger. Just making sure that there's enough time to be able to come back to the board on Tuesday with a final MOU or a final agreement.
I will make it happen as long as they get it to us. I mean, that's, you know, and we're hoping to have it today, but I don't know. I haven't heard from them yet this morning.
Okay. All right. Any further questions from the board? Let's go ahead and reopen it up. I don't even know if I opened it up for the public. Again, come to the microphone if you have any questions or comments.
Joan Moss. I'm sorry to be the one to always ask questions, but I'd like to know if people coming into the fair will get free tickets into the fair if they get a vaccine?
I believe that is a different agenda item that will be coming up.
Oh, you're not going to answer that question? I mean, this is what...
We can discuss it at that agenda item that is on our agenda today.
I thought that was what we were discussing, no?
No, not right now. Right now, we're discussing a contract with OptumServe for a mobile van unit to do vaccines.
I think there should be a mobile van offering COVID tests also. Thank you.
Thank you very much. Any further comments or questions? And let's bring it back. I believe we have consensus on how to move forward. I don't think there's a need for a motion at this time. Looking at Ms. Grant, who's shaking her head no. All right, thank you so much. And thank you again to the public health team.
Thank you.
And all right, now let's keep moving to our 9:45 a.m. item, presentation of letter on presentation of letter on behalf of the Lake County Drought Task Force recommending the board enact water conservation measures. Good morning.
Good morning.
Would you like to come in the seats up front?
Sure. Good morning. Is this on?
No, you have to not push it. There you go.
Good afternoon. This is on now. Awesome. Thank you, board, for having us. Thank you, Mr. Chair. My name is Marina Delajanis, and I serve as the Deputy Water Resources Director for the Lake County Watershed Protection District. I am joined by Lake County OES Manager Dale Carnathan, and we are coming to the board on behalf of the Lake County Drought Task Force Work Group, which is a non-board appointed work group that we have been meeting routinely for the past few months. So as you can recall, on May 11th, 2021, the Board of Supervisors passed resolution number 2021-55, Proclamation of Emergency Declaration for Drought Conditions. And on July 27th of this past year, representatives from the Lake County Water Resources Department, Office of Emergency Services, Environmental Health, Special Districts, and Lake County Drought Task Force Work Group, a work group organized by the California Department of Water Resources, provided an update on current drought conditions. So in this presentation, we promised that we would come back to the board in the next month with the letter that has been drafted by the Lake County Drought Task Force Work Group. And now I'm going to pass it over to Dale Carnathan, again, Lake County OES Manager, to read the letter drafted by the Lake County Drought Task Force to be read to you today.
Good morning.
And Mr. Carnathan, if you could put your mask still on. As long as you're speaking in the microphone, we'll hear you.
Okay.
Thank you.
All right. This letter is dated today. It's addressed to Chairman Bruno Sabatier, Chair, Lake County Board of Supervisors. Dear Chairman Sabatier, as you're aware, Lake County is in the midst of a severe drought with no relief in the foreseeable future. We are currently feeling the effects of El Nino neutral conditions in the south central Pacific Ocean, with indications that we may descend into a second winter with La Nina conditions, similar to last winter. Of course, we know that either condition, El Nino or La Nina effects, can be highly variable. Clear Lake has already receded below zero on the Rumsey scale. To put this into perspective, as of August 23rd, 2021, Clear Lake was at minus 1.47 Rumsey compared to August 23rd of 2020, where Clear Lake was at 1.83 positive Rumsey. There are anecdotal reports of wells no longer able to provide useful water to their owners. Several water purveyors are taking actions to preserve their access to water by extending their intakes further into Clear Lake. The Lake County Drought Task Force has been meeting bi-weekly to assess the needs and potential solutions to issues surrounding the drought in Lake County. The task force consists of representatives from the state, California Department of Water Resources, State Water Resources Control Board, County Public Works Water Resources, county special districts, tribes, private and public water purveyors, and the Sheriff's Office of Emergency Services. The task force meetings have resulted in an open dialogue for discussion of water-related issues, an initial public information and awareness campaign, the sharing of resources and potential solutions, and an agreement that Lake County should enact a water conservation and use policy as soon as possible. As of this time, the only policy restriction on water use in the county code is intended to prevent the export of groundwater. That's County Code Section 28-11. Furthermore, County Code Article 8, Section 9.61 states, "No person shall construct, repair, reconstruct, destroy, or abandon any well, monitoring well, or cathodic protection well within the unincorporated area of Lake County unless a well permit has first been obtained from the health officer. In emergency situations involving an existing agricultural or public water system well, where immediate work on or replacement of such existing well is necessary to prevent interruption of service, verbal approval to commence work can be given by the health officer or his designee, with the above required permit to be obtained during the next regular county working day. However, this code applies only to the well's construction and not to its use. There are reports from reputable drillers with valid permits that other wells are being drilled without inspection or permits. The Lake County Drought Task Force strongly recommends that the Lake County Board of Supervisors enact conservation measures in conjunction with the Lake County Water Resources and Environmental Health Departments and other private and public water purveyors to restrict the use of water and to identify and develop enforcement tools to encourage conservation and prevent water wastage. If pursued, this restriction among Lake County residents would align with Executive Order N-10-21 signed by the Governor of California, Gavin Newsom, on July 8, 2021, calling all Californians to voluntarily reduce water use by 15% from their 2020 levels. Some of these tools might include restrictions on watering, times and durations, required inspections of equipment, metering of wells, use of flow restricting devices, and moratoriums on the issuance of new well and use permits that substantially affect water supplies or sources. The Lake County Drought Task Force will continue to meet on this critically important topic and would be pleased to assist your board in the development and enactment of rules to protect our endangered water supply. Sincerely, the Lake County Drought Task Force.
Thank you very much for the work that you're doing, and thank you for this very important letter. Are there any comments or questions? And I will say that some of these items have been discussed here at the board. Obviously, the actions have not been taken. I'm very interested, as soon as possible, to discuss how we can continue to conserve water, especially knowing that I'm hearing the reports as well, and this was corroborated in your report today, that we are not expecting the water that we would love to all have over the course of this winter. Now, I know the meteorologist is never always perfect, and I'm really hoping this time that they're wrong, but it's something we need to prepare for, and I think it's important that we review some of these items. So I am absolutely in favor in asking the departments listed in your letter to work on a proposal to come back to us so we can discuss, in my opinion, all of the items that are on the list. And looking to see if that's Supervisor Scott.
I definitely agree with that. And even if we knew we were going to be getting inches and inches of rain this coming winter, there's always going to be drought down the road. So we need to be looking at these. So I definitely agree with that.
And again, even if they predict war water, doesn't mean that they're going to be right. Supervisor Pyska.
Well, at this point, we have to plan for a very dry winter. We're in the position that we're in, and we have to expect that. If we get more rain, that's great, but for our sustainability and our planning, this is where we're at, this is our reality, and this is what we have to plan for.
Supervisor Simon?
Yeah, absolutely. I'd agree that more conversation needs to be had as we're looking at this. And like I've been saying, this won't be the last drought that we go through. So looking at those opportunities that we can enact now are important. And studying each geographic location in the county, because each is different. You know, obviously the folks pulling water out of the lake are more affected than the folks that are using the groundwater out of the aquifers. So just looking at it as a whole, you know, as a holistic situation throughout the county, you know, because obviously my district is, you know, on the south end is a little different than the top end of my district, which pulls water out of the lake. So looking at it, but absolutely conservation in all aspects moving forward should be something that we're looking at. We're talking about it for fire. We're looking at it, you know, in other areas. So yes, I'm in favor. Let's have those conversations and see what we can come up to benefit all of our constituents.
Thank you. Let's go ahead and open it up for the public. And we have Alyssa, who has her hand up in the Zoom room. Please provide your name.
Hi there, can y'all hear me?
Yes, thank you. And you have 3 minutes. And again, please provide your name.
Nice, thank you. My name's Alyssa Gordon. I am the project manager for the Hidden Valley Lake Community Services District, the water wastewater utility in the region in which Supervisor Simon referenced. We're in the southern part of the county, and we are drawing water from the aquifer. But I just wanted to speak in support of this letter and the Drought Task Force in general. I am a member of the Drought Task Force, and just wanted to drive the point home that we are looking for a holistic solution. We're all in this together. I've written a few words because I'm nervous speaking in front of this auspicious audience. So if you'll indulge me, it won't be more than 3 minutes, I promise. We're grateful for the opportunity to participate in a county-wide organization. We work together in a single industry, water, for common goal, the continued delivery of safe drinking water. Of the water agencies in this group, we are all unique in our delivery of the same service. The size of our customer base varies, the source of our water, the method of treatment of the water is different, and our organization structures are different. But when we meet together as a group, this variety serves as a benefit. We're learning from each other. We're collaborating. We're talking to each other. This water connection that we share is also evident in the general geology of the region. While Hidden Valley Lake CSD draws its water from the ground, and the city of Lakeport draws its water from Clear Lake, for example, we're all connected in the same watershed. The area surrounding Clear Lake is part of the Upper Creek watershed, and the southern portion of the county is part of the, Upper Cache Creek watershed, and the southern portion of the county is part of the Upper Poudre Creek watershed. But both of these watersheds are part of the Sacramento River watershed. Again, we're all in this together. This is a natural resource that we all need to work together to properly treat and be good stewards. The Lake County Comprehensive Economic Development Strategy of 2016 summed up the connection between groundwater and surface waters. Water from streams and lakes seep down into aquifers, or where aquifers or transbanding formations are exposed to the surface, precipitation percolates directly into the aquifers. So you see how we are all connected in that rather technical way. Again, HDL-CSD is grateful to be part of this important group, and we support efforts to protect this natural resource. Thank you for your time.
Thank you very much. Next, we have Jennifer Smith. And again, please provide us with your name, and you have 3 minutes.
Good afternoon. This is Jennifer Smith. I know that cannabis has been a big target in some of this drought conversation and policy making. And so I would just like to know, what is the best avenue? Because there are several presentations that have been made both to the board in writing and to the Farm Bureau, as well, maybe not the Farm Bureau, but definitely the Ag Department, about water saving techniques that we have available to us, whether it be through berry hoops or hoop houses. We can save up to 20% of our water consumption, and yet these practices aren't being looked at seriously. They're not being considered, and I think that we need to find some ways, while these best practices, not just in cannabis, but all agriculture, they exist, and we need to find ways to get them implemented, and looking at that long term, like, again, not just looking at this for this year or even next year, but having this plan in place and these practices available for our use. So I would like for the board to consider how we start looking at these opportunities that are available, just not being utilized. Thanks.
Thank you very much. And I think what you're alluding to is the idea of a drought management plan, which at this moment we do not have, but there are conversations occurring within the county staff about the creation of that plan, as it is important to have something to help lead us in what needs to be changed during times of declared drought emergencies. And so I appreciate the comment. I see no further hands up. Any hands up in the boardroom on this? Okay. Please provide your name, and you have 3 minutes.
Hi, my name is Mike Mitzel. So I think there's a lot of good points brought up in that letter. There's also some scary ones, like a moratorium on all use permits. I think that the drought ordinance that you guys passed a couple weeks ago addresses at least some of these concerns that were brought up in there. And I think that that is a better way to go about it than just putting an all-out ban on all use permits. If you, the way you guys set up the drought ordinance to look at each project individually and the impacts of that project on neighboring properties is a way more efficient way to do it. Cannabis already has a lot of those measures that are noted in that letter, like metering of water, and there's more regulation on the cannabis side of water than definitely any other industry in the county and the state, probably in the whole world. But I just feel like that urgency ordinance is a way better way to go, and just reenacting something like that would be better than putting a moratorium on all use permits. So thank you.
Thank you for your comment. Any further comments before we bring it back to the board? All right, bringing it back to the board, and I believe we had consensus to have staff work on those things, or the task force.
Yes.
Seeing yeses. All right. Again, thank you very much. We're all as concerned.
Thank you so much, board, and we will see you in the next few weeks with a proposal.
Thank you. Okay, let's go ahead and move on to our 10:30 a.m. item, consideration of urgency ordinance regarding water haulers delivering water to cannabis cultivations. And if it's possible to put up on the projector screen, or I guess if we could just share in the Zoom room and have that be on the projector screen, the actual ordinance itself. It's fairly small and simple to be able to do that. And if we can just kind of scroll past the whereas. And hopefully that helps a little bit. So I do want to introduce this. Lots of complaints and lots of conversations about water trucks, water haulers. Sorry, I really need to specifically say that term. And the reason why I don't want to say water trucks is because there's all types of vehicles that are carrying water around right now. And the complaints that we receive oftentimes are that trucks are delivering to cannabis grows. Hard for people to know whether a cannabis grow is a legal grow or an illegal grow. My time is up?
Sorry, Mr. Chair. You're done. Mr. Chair, I hate to interrupt you, but we needed that local health emergency ratified with your signature, and I believe it's in your inbox.
So we need to just take a quick 10-second break. I am told I need to sign something for Cal OES.
That is needed to be passed on, so thank you.
If you can just indulge me for a few more seconds. I won't even sign. I'll just type my name. You're welcome. My name is spelled correctly, so we're good. No, I want to make sure you get this, so thank you so much. Okay, sorry about that. So again, most of these things are happening in our illegal grows. And so basically, at first I started thinking about the process of how to do this. I thought about going through a permit process where all water haulers get the permit. Then I started thinking about the difficulties of that. Am I going to have Caltrans trucks that are working on our projects out here come here and get a permit? Do I exempt them? If I exempt them, how do we know who's permitted and who's not? It just became a real difficult task. Sat down multiple times with Ms. Grant, our county counsel, to discuss this. At the state level, they have a licensing process. And so there was no need to kind of overlap and do what the state was doing. And so I eventually really just went simple. Kept it really simple. If a water truck is seen delivering water at a cannabis grow site, then they will be penalized. There will be an administrative fine. Within the ordinance, it talks about, it relates to, I forget the exact chapter of it. Let me see if I can find it. Section 13-13 of the Municipal Code, which is where our administrative penalties are. At this moment in time, we are reviewing the administrative penalties, but it would still relate back to that exact same location. During our conversation with the administrative penalties, I brought up, based on some conversations that we were having about similar to the construction road penalties, how you get a double fine. In speaking with Ms. Grant about this, if there was a specific term that would be identified in our administrative penalties as these types of violations are related to a double fine, a triple fine, whatever we end up doing, that if we have a term, then we can utilize that term in other ordinances to basically say these are high severity violations. So the term is high severity violation. Most likely we might see that in the upcoming administrative fines. If it's not approved, then that line means nothing, but it would still be available for administrative penalties based on what that, the end result of that ordinance upgrade will look like. I just think that because of the severe drought and this being an urgency ordinance, that it does fit as a high severity violation. You are using water typically for things that have not been assessed through the CEQA process. And then also it does go over the legal cannabis where in Part F of the 27.13 AT3V, it talks about how you can have water delivered if there is an emergency, and you have 7 days after doing that to relate that information to CDD. And I feel that there's not a definition of what emergency means. And in my opinion, if your water pump dies and you can't pump water out of your well to water your plants, that is an emergency. But when it's a long-term drought and you don't have water, I think that's not an emergency in the sense that you can now have trucks coming every single day dropping off for your grow to continue. And so I identified that a emergency is a temporary issue that can be resolved within a short period of time, less than 14 days. A declared drought emergency shall not be deemed an emergency for this section and shall not allow for water to be supplied by a licensed retail water supplier. And that covers, I believe, the gist of this urgency ordinance, and I'm open for questions, suggestions, or changes. Supervisor Pyska.
So I'm glad you clarified the water truck, water hauler part of this. It was a question that I had. I know in my conversations with supervisors in Trinity County, they have a 100-gallon limit. If it's more than 100 gallons on a truck, then it falls under an ordinance like this. So we have non-commercial trucks with a removable water tank. Tote, yes, on the back. So this would apply to those as well?
So the water hauler definition that I placed in here in the definitions, any individual or commercial entity that operates a truck or tanker carrying water, I got that out of the California State Code. I wanted to at least stick with that. Now, we can look at revising that, and I would suggest that Ms. Grant help us to make sure that we don't just create something that doesn't work. But I wanted to make sure to utilize something that was supported at least by our vehicle code, even though this is not a vehicle code violation, but didn't want to create a definition out of thin air.
Yeah. What do you think?
Your microphone's gone.
Hello. Hello? Yeah, okay. I'll just talk into my lapel.
I'm not wearing a wire.
This is comfortable. The CIA is going to be looking for somebody like me. I'm so subtle. I do think that you'd be looking then at redefining water hauler for purposes of this ordinance by virtue of how you want to refine the definition. I was just looking through the ordinance to see if that would be
Thank you. Thank you. Yeah, I think you could. I think you can just simply refine the definition of water hauler for purposes of this ordinance, and it would carry through then and only be applicable to how you define it. So if you're looking at changing the definition from an individual or commercial entity that operates a truck or tanker carrying water to either carrying water of over X amount, or however you'd like to narrow that definition in your discussions today and after public comment, that would probably be a fix that you could make directly on the face of the document today and still move forward.
Yeah, I'm less concerned that we define it by the amount of water, just that these smaller trucks are covered under the ordinance.
I'm okay with that change if that's what we choose to do.
Okay. And then just for clarity, we're reviewing the administrative fines, but what we currently have as administrative fines would be applicable until we make those updates.
And there's a yes from Ms. Grant as well.
The ordinance with the updated administrative fines is coming back at the next regular meeting of your board on the 14th of September.
Okay. That's it.
Thank you. Supervisor Scott?
And talking about administrative penalties, are we going to be looking at code enforcement to be administrating these penalties? How is the community going to maybe help us track down these trucks? Because it's a fast process. They go in, they deliver, they go out. How are we going to catch these guys?
So in my opinion, and I think that code enforcement will have to come up with their strategy, from my conversations with code enforcement, they go up to these grows, these illegal grows, and they see the trucks already. And they just have no tools to go after the trucks because there's nothing on our municipal code that says that the trucks are liable for delivering to illegal grows. So my opinion is keep going after the illegal grows and you're gonna catch these trucks, and once you start catching these trucks, we're gonna slow things down a whole lot. I think that just solely staking out and waiting for a truck is a waste of their time. But I think that in conjunction with the other work that they're already doing, with the priorities we gave them, which was illegal grows, we also gave them the priority of illegal water hauling, and this needed to happen for them to have some sort of teeth to be able to do something about it.
And then would we be able to go after those that are permitted and having water delivered and they shouldn't be, because I haven't contacted CDD? Can the public be able to take pictures and send those in if they see trucks going in and out? Because I know I get many calls about trucks moving around from the community, and they're more than willing to step up and help.
And I'm not going to speak for CDD, maybe CAO Hutchinson can, but I'm sure that it doesn't hurt to receive that kind of information.
But will we be able to go after these trucks if we have these pictures, or do we actually have to have CDD catch them?
Well, I thought the intent really was for when CDD sees them in action to act, but I did not envision that they would, when code enforcement sees them in action to take proper steps. But to actually go out and try to find them, I did not think so.
But I think that level of information would be helpful.
Yes.
And most likely, if that information is provided, then it's also information about illegal grow. And so if we go after either one, it will slow down the request for water during our drought that we really need to conserve water as much as possible. So I think that level of information is going to be helpful, and we'll let code enforcement figure out how to best utilize that and go through a process. Ms. Grant?
I'm sorry. Thank you. And certainly that level of information is an impetus for further investigation. So it does alert them that something untoward is happening. And that's valuable in and of itself. It may also be valuable in determining the amount of the penalty if anything establishes frequency, et cetera. So there's a number of uses. Information is always valuable.
Thank you very much. Any further? Oh, Supervisor Pyska.
Just one other point for the public. I think we'll have to update our code enforcement form so that there's a way for the public to log a complaint rather than sending it to us and then we pass it along. So we need that formal pathway in place.
Okay. Any further comments, Supervisor Crandall?
Yes. Did you cover already, oops, I'm sorry. Did you cover already the water hauler license procedures under the Health and Safety Code already, I think? Was that mentioned?
License procedure?
Because I didn't see it. Well, there's an email I got from a constituent, and I'll just read it.
I know that there's a license procedure with the state, with the Water Board, Water Resources Control Board.
Okay. Yeah,
but I did not go over that.
Well, I'll just read it off, and then you can tell me if we covered this or not, because I think we mentioned something along the lines. It says, it is highly likely that water haulers are delivering water to legitimate law-abiding citizens and customers as well. What means are available to police the end users or to make a distinction between legal and illegal customers? According to the California Health and Safety Code, Section 1111120, water hauler license procedure, a license is required for anybody hauling more than 250 gallons of water. And there was no quick reference as to whether a licensed hauler is required to keep a log or possibly report delivery data back to the state. But if so, this could possibly be a method of policing. That makes sense.
And so I will say that this should not impact at all. That is not the intent of anybody using water for anything unless there's cannabis activity, commercial and illegal cannabis occurring. And so there's, it even says in there that it does not impact the adult use. So if you have your 6 plants, you're not going to get in trouble if water is being delivered to your house But if you have hundreds of plants illegally or thousands of plants legally, there is already a speculation in that ordinance saying no water deliveries. And it also states in here that we will be in contact and communication with Water Resources Control Board if we find a water hauler to abuse this. And whatever happens through them is what happens through them, because we do not have the ability to take action at the state level.
Thank you. It covers it. And, well, and everything else I think Jessica covered. A lot of people are concerned about the totes in the back of the trucks. That's the main thing, but we covered that, so.
Yeah, it sounds like we can change the definition to cover all that. Supervisor Simon?
Yeah, and, I think we're moving in the right direction. Obviously, we'll see what happens today, but, my clarification, which I think you did a little bit of that, is to make sure that, because I have a lot of constituents, especially in my south end of my district, past our tribe down there, all the way to the county line, where every year folks are hauling water to take care of themselves and their homes. So I just want to make sure and get that clarified. What we're talking about here is for illegal cannabis deliveries. I know the last time this came up, a lot of folks sent emails, called me and asked, hey, we do this to survive. So I just want to clarify that for our communities out there, people listening. This is not if you are looking to take care of your well going dry and you're just surviving on this water as these deliveries are happening. I really want to clarify that, because I know there's going to be, as always happens, unintended consequences. And I just want to make that very clear, that this is not for personal use. You can deliver water to your homes as needed and continue to do that. So,
thank you. Let's go ahead and open it up to the public, and go ahead and come to the microphone and raise your hand as well in the Zoom room. We'll get to the Zoom room when we're done here in the chamber. Please provide your name and 3 minutes.
Hi, my name is Mike Mitchell. So I have a few questions. I don't believe that a legal cannabis grow that runs low on water in a drought should just be left stranded. And that's basically what you would do if you don't let them use the drought as an emergency and they can't bring in water. I just don't see where the evil act of that really lies. It's like you have a approved project whose well isn't producing what it was when it was approved in a severe drought, and now it's like, what do they really do at that point if they can't bring water in? Do they just abandon the grow? Do they have to pay the tax after that? If you have a planted grow and your well runs dry, are you still on the hook for all the taxes after that if you can't get the water delivery? And then my other question is, there's a lot of grows that use water deliveries for dust prevention, because you get dust on the plant and it pretty much ruins it. It can test for asbestos and other chemicals that'll make you fail the testing. So there's a lot of grows that are using water deliveries to spray down the roads. And so just a water truck going into a grow site doesn't really prove that you're doing anything wrong. Even under the ordinance now, that's fully allowed to use water as dust management. So it seems like it's very unenforceable, and just because you see a truck going into a grow doesn't mean that they're up to something that's illegal. There's a lot of holes in enforcement of this, I feel like. So I think the theory behind it and the thought behind it is there, but I definitely have a problem with excluding permitted grows from ever getting water deliveries. If this isn't an emergency, what is? And then what do they do if they can't get a water delivery? Are they just supposed to close the use permit down until the well produces what it did? And then if you, the last thing, you're trying to shut down well permits, or there's a recommendation to shut down well permits. So the obvious thing would be, if your grow is running low on water, you drill another well, but it doesn't seem like you're even going to be able to do that in the future. So I just don't know where that leaves a permitted grow that's well isn't producing what it was when it was permitted. So I don't know. Thank you.
So I just want to say that example that you gave would absolutely not hold water. Just because we see a water truck going into a direction, we have to have a little bit more faith in our code enforcement officers that they're building a strong case, that they are seeing water being placed in an area where it is going directly to the plants. It wouldn't just be that you happen to be at the neighbor's house and you're close enough, so therefore we're going to, our code enforcement create a case. They don't bring things that have holes and gaps to us. We've had some appeals here before, and I believe that our code enforcement can make a valid case and will have a strong case if they do these types of penalties. And as far as a farmer not having water, we all have to figure out how to go with less. And if a farmer is having to take water from somewhere else to figure out how to continue doing their normal operation that's not going to be minimized due to drought, then I think that farmer made a mistake in planting a full field knowing that we are entering into a very extreme drought. And we all need to sacrifice. This is a community issue. And pulling water from one area to bring it to another does not solve the problem at all. It makes it so that the people around you probably already don't have water if you don't have water, and now you're taking water from somewhere else where now the same thing may occur there. And I want to see the stopping of water traveling around in our community. That is my number one concern, because there is there's nothing to control that at this moment in time. And then we have a comment on the Zoom room, Alex Paul.
Hi, can you hear me?
Yes.
Hi, thanks for giving me the opportunity to speak. I live in South Lake County, and I think my question, the essential question I have for the board is the legal cannabis grow water use clarification section. And I guess I want to understand why we would only target cannabis, legal licensed cannabis growers in this section. So for example, if I owned a winery, would I be subject to this particular provision or not? So I guess I just want to understand why that part is only focusing on legal cannabis growers, and what happens if they can't fix their well pump within the 14 days or something like that. That's all I had. Thank you.
Thank you very much. My reason for focusing on that is that that's what I'm getting as far as complaints from other growers as well. And it's inside our ordinance and has been stated again and again that water trucks are not to go there, and to suddenly decide to use this emergency as a reason to now allow water trucks, I wanted to make sure and clarify that, as I do not believe that that should be the case. I forget what your second part to the question was. And other ag don't have those provisions in there, and in my personal opinion, we need to work to create those same level of provisions to treat everybody the same. But at this moment in time, those are not provisions within their ordinances. Next is Jennifer Smith.
Good afternoon, Jennifer Smith. Echoing both Michael and Alex and their comments, it does seem seems very subjective and punitive towards the cannabis farmers. It seems, as a legal cannabis farmer, we all know that we're not supposed to be using water trucks, that there are exceptions during emergencies. And I think what's relevant to point out is these emergencies could become greater as we deal with extended PSPS. We had 4 days of no power in Lower Lake the other day. Generator issues, fire issues, not being able to get out to get fuel to fuel the generators. It becomes quite a cyclical issue. And I am happy to hear that you are going to perhaps look at all agricultural crops and water restrictions and the use of trucks, because if we're going to be declared ag, and if we are going to be a sustainable industry in this county, we need to start leveling the playing field and quit using cannabis as a piggy bank and then turn around and be punitive towards it. So I'd like to see this ordinance be very specific to illegal cannabis grows and find ways that we're all conserving water, but working, not pitting agriculture against other agricultural commodities. Let's work together as a community to make this work and not be punitive towards those that have raised their hands to be legal and pay taxes and be participants in this community. Thanks.
Thank you. Chris Pivniska.
Can you hear me?
Yes, we can.
I just want to know why code enforcement wouldn't go after the illegal growers. Why would they go after someone that's strictly hauling water, you know, who's 100% legal? I just want to know why they wouldn't go after the growers that are growing illegally.
I guess my question is, why not go after both, since the activity is illegal completely? That's just the way I feel. I think that it's helping an illegal grow makes anyone helping complicit to that illegal grow. That's my opinion. But thank you for your comment. Any further comments from the board or Zoom room before we bring it back to the board? Okay, bringing it back to the board. Supervisor Pyska.
So this is about sustainability and protecting our resource. We get a lot of complaints of water trucks going to cannabis grows, and I think that's why the focus is here, legal and not legal. And so that's the issue that we're trying to address. There are products that can be used to keep the dust down. I was at a grow last week where they are applying an organic product with no residue. They were not able to test, they didn't test, the testing showed 0 residue on their plants, and they can apply that product once a month rather than using water. If you're using water during this summer, during our heat waves, and given how dry our soil is, you would probably have to apply that water many times a day. So it's just not a sustainable way to manage dust on farms. And that's really what this is coming down to. If you're on a property that can't sustain a grow, then that's probably not a property that should have a farm on it going forward. This is our reality. We already discussed earlier that we may not have a wet season. So if this season took anybody by surprise and they planted too much, this is a lesson learned. Maybe next year you can't plant that much, and we have to continue to adjust because the sustainability of this resource has to be our top priority right now.
Thank you. Supervisor Simon? Oh, you were halfway up.
Yeah, I'll let Supervisor Crandall.
Supervisor Crandall?
I think the thing to, just to add is there's just so many illegal grows, and my focus is more, and I appreciate that there is a discussion about the legal grows as well in the whereas section and what we've discussed. But the illegal grows, especially in the areas that I've been having to focus on, mainly in Spring Valley and Double Eagle, because out there they're community growth boundaries, and when there are trucks out there delivering water to grows that really shouldn't even be happening, that's where I've even witnessed it myself. So knowing that there's also people in the community of Spring Valley who have multiple pictures of it. So having this will help with their pictures, their reporting, and things of that nature. And then eventually we can get to a point of identifying if there's a real use for that water. But another thing to add is that contributing to those illegal grows while we're missing out on actually tagging them and pulling them, and it takes a long process to do that. The sheriff had mentioned to me before that in order to get as much done that we needed to in, let's just say, the area towards the Yolo County line, he'd need at least 2 or 3 days, if not more. And so you're leaving out a lot of different grows that are just kind of sitting. And with that in tune, you got people delivering water or even illegal. We know, we've seen and have pictures and proof of people actually pulling from the ponds, and those are the totes, and that's why I brought that up as well. I'm just adding to the discussion, and just wanted to say I thank you for bringing this forward.
Thank you. Supervisor Simon?
Just wanted to follow up with some of the public comment that they had, and I do agree we need to look at all ag, eventually here. Today we are talking about illegal cannabis, and that's really what I want to focus on, because I think there were some valid points to be made about the, our permitted legal cannabis grows. We are looking to establish the industry, so I would request that we do for this season. Ultimately, we do not know what's coming down for the next winter. We need to be as prepared for possible, but we may get the rain. We may not. As you said, it's not a perfect science moving forward. So let's hope we're going to get what we need to. But I think we are trying to establish a legal permitted industry here, and I think it warrants that we have that conversation. And so my request is that we do, make a change in this ordinance, that it is for illegal grows, and we work through the process maybe of adding that if you are a permitted grow, that you must be communicating with community development and your needs to continue your operations, because we do know that they are not the only industry moving water around in this county. We do have small wineries and vintners that are probably running into the same issue of wells going dry or being able to pump out of the streams like they had previously, but the creeks went dry this year. So I think there were some valid points made by the industry that as we move forward here, my focus is on the illegal. We want to continue on those paths. I know it's a challenge. The enforcement issue too, I will say, I don't know how we're going to enforce this. That's a real challenge. We don't have the officers, we don't have the code enforcement officers to be out there. There is a lot of confusion, like I said, a lot of trucks moving around, but I would ask this board if we could entertain making some changes to I guess it would be the language for the current disaster that we're in right now, or the current emergency. And that would be the urgency remains in effect. The emergency is something that can't be solved 14 days. We know it's a drought, but we do have legal permitted cannabis growers that are going to need help to get through this time that we're in right now. I understand each and everybody, you want to do the water permits. I know we've implemented others so they can do better and more fully comprehensive water studies before we approve some of the projects we want to move forward with. So I will put it out there that we're trying to establish an industry. It makes it challenging, but we need to have the conversation today. That's what I have.
Supervisor Scott?
I agree with Supervisor Simon. We have done everything we could to make sure that we are working with permitted growers and giving them a pathway to do this legally. And I do believe we need to be working with them this year. We all kind of knew that drought was going to be coming. But again, you have to look at it took these people probably 3, 4, 5 years to get to this point. So when they started, there was no drought issues, but now we are in a drought issue. So if their wells do run dry, I think we need to be working with these growers to try to figure out how they can continue having their farms for this year, but maybe next year cutting their farms back. I don't know if it taking this out of this ordinance is something we should do, but we do need to have a pathway to be working with our permitted legal grows. If it's to the point of helping them or providing them be able to get the water, or cutting their taxes if they have to abandon their farms, but we do need to be working with them in some way.
Thank you. Supervisor Pyska? Is that an old pen or is that a new pen?
That's an old pen.
So I'd like to make an offer and a suggestion, and Ms. Grant, if you can follow along and let me know if I'm tripping anything up. I am willing to delete the entire Section C, which is all about the legal cannabis grow, and then the definition of what emergency means. There's no need to have Section C at all if that's what we get rid of. And then adding in Section 1, the Sentences, due to the exceptional drought that we are experiencing and the declaration of a drought emergency, all water haulers found delivering water to a property where any illegal cannabis is being grown, or unpermitted, let's use unpermitted, cannabis is being grown, with the exception of properties following the rules of regulations, blah, 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 shall be held accountable for delivering water. I think just by saying unpermitted, then that means that those who are permitted and are legal now do not fall within this category of what we're discussing. And then a little further down on section B with the definition of, water hauler regulations regarding unpermitted cannabis activities. And again, if a water hauler is found to be delivering water to a property with unpermitted cannabis activities, their activities shall be deemed in violation of this ordinance, and the water hauler owner business shall receive an administrative penalty. And then I think we need to discuss the definition.
Of water hauler.
Yeah.
One of the issues that you still would need to correct then, sir, is you keep referring to illegal activities, but then you change to unpermitted. So there's a consistency in an urgency ordinance in particular, though it should be in all ordinances. You want to use the same terms throughout. And when you're saying unpermitted, then you are meaning where a county permit is required to be obtained but has not been obtained.
Would you be able to provide better guidance on those changes?
Yes. I think that if you want to continue with, it depends upon which does your board prefer. I can fix it either way. Do you want this to be unpermitted or illegal grows?
I think unpermitted would cover it, and then there's the exception for the adult use, which I think just pretty much says what we're looking at.
Yep.
What's the focus?
Okay.
Do you need a 5-minute break to review for the definition and for the changes
That
of?
would be wonderful.
10
Thank
minutes?
you. No, 5 is fine.
5? Okay, let's go ahead and take a 5-minute break, and we will come back at 12:28, and it's almost lunchtime.
Yeah, you saw that too.
Well, I'm guessing it's West Paul now, but I'm gonna.
Check, test, 1, 2, check, 1, 2. There we go.
Yeah, I think so. Okay, I'll double.
All right, let's go ahead and bring it back. And last time we left here, we were asking for Ms. Grant to go ahead and do the clarifications or the changes that we had provided for her. Ms. Grant, would you please be able to provide those changes?
Yes, thank you very much. I do notice at the very beginning that the title of the urgency ordinance needs to change.
Oh, my goodness. That was my original intent.
Yes.
Prohibiting water hauling to unpermitted cannabis cultivation.
Sites, yes. With that change then, under the 6th whereas, water trucks have been witnessed dropping off water at cannabis cultivations, and there are no ordinances available to curb those illegal activities of providing water at locations where cannabis cultivation occurs without the required permits. Then under number 7, while cannabis activities can be held accountable for the illegal activity or the violation of receiving water haul deliveries, water haulers, I would say, while illegal cannabis activities.
Or do we want to keep it with unpermitted?
Well, you can do it that way too. It really doesn't matter because we're defining unpermitted down below, but unpermitted cannabis activities can be held accountable for the illegal activity or the violation of receiving water haul deliveries. Water haulers are not currently being held responsible for taking part in the unpermitted grows.
Okay.
And then under section 1, due to the exceptional drought that we are experiencing in the declaration of a drought emergency, all water haulers found delivering water to a property where unpermitted cannabis cultivation is occurring, with the exception of properties following the rules and regulations of the Adult Personal Use 27.3Z, shall be held accountable for delivering water to benefit unpermitted cannabis cultivation. Under A of section 1, water hauler, any individual or commercial entity that operates a truck or tanker or other means of carrying water. Actually, any individual or commercial entity that operates a truck or tanker or uses other means to carry water. And then adding two definitions under A, sub C, unpermitted cannabis cultivation means cannabis cultivation which occurs without having first obtained the required county permits, which occurs within the unincorporated area of the County of Lake without first having obtained the required county permits and state licensing. And then sub C of section 1 would simply be deleted, and the ordinance then would go on as follows.
And I believe in sub B part A, if the water hauler is found delivering water to a property with unpermitted cannabis cultivation.
I'm sorry, yes, sorry, missed that one.
And the rest, I think,
Yes.
I agree with the changes. Okay, any further conversation or deliberation, or are we ready for action? All right.
This is an urgency ordinance, so with a 4/5 vote, your board may adopt it today, and it's effective immediately.
Thank you very much for that. Supervisor Simon?
Mr. Chair, I'd like to offer the ordinance with the revisions.
Ordinance has been offered. Johanna, roll call, please.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
Thank you very much. Let's go on to our next item. Our next item is 6.6, our 11 a.m. item. Public hearing, appeal of vicious animal abatement case number 859, located at 21852 Jerusalem Grade, Lower Lake, Brandon Strausser. Good morning, or good afternoon. It's been a long morning.
Good afternoon, Mr. Chair, Board. My name is Jonathan Louie. I represent Lake County Animal Care and Control. I believe we're here today to report on the progress with regard to Mendocino's approval or disapproval. I'm happy to report that I got final confirmation today from Richard Molinari, who is the director for Mendocino Animal Control, that the conditions that they had have been finally met, namely that Ms. Matthews get the insurance for $50,000. That has been met. That they get 2 vicious dog permits, $100 each, which were just picked up today. That the dogs have their rabies shots that has been taken care of by Lake County Animal Care and Control, and that they complete their inspection of the kennels. And I do have confirmation from Mr. Molinari that was done and it meets their standards. Simply put, the only outstanding thing left would be for the board to approve a redemption, at which time Ms. Matthews can pay the redemption fee of $3,389 to Animal Care and Control, and at that point take the 2 dogs and go to Mendocino, to her home there, where it's now been approved by their animal control.
Sounds like a happy ending to me. Thank you so much for the update. Anything further?
Not from Animal Control, Your Honor. Mr. Chair.
Anything, actually just want to make sure that the Brandon Strausser or representative has the chance to speak if they wish. And again, I believe everyone who's speaking today, if anyone new will be speaking, this is a public hearing. If you have not been sworn in, let us know, but I believe you have, so please go ahead and approach the microphone.
Thank you, ladies and gentlemen of the board. I just want to say, I want to offer my appreciation to the board and also to Animal Control and everyone, Mr. Louie and County Counsel's office, who has helped solve this problem, and I believe it is a happy ending. I'm Edward Savin. I don't think I said that.
Thank you so much.
Thank you.
Any comments or questions from the board? All right, let's open it up for the public. Have you been sworn in for this public hearing in the past? I believe you have. So go ahead and please come on up, opening it up for public comments.
Joan Moss. I sent a Freedom of Information Act request to get all the public records and evidence available, and I sent it within 10 days. I never got a reply from either party, the Lake County or the Animal Control, though they say there's documents waiting for me at their office. They might have brought them here. Number 2, I was over in Mendocino County, and I called the Animal Control and the Animal Shelter and the Sheriff's Office and the Police Department. None of them knew of a hybrid wolf coming to Mendocino County. I still have a lot of questions. I've done a lot of research. I know that it's illegal to harbor and cage a wild animal. And I still say that this hybrid wolf might be more wild animal than dog. So I'm going to keep researching, but I didn't have an email at the time, I must say that. that they tried to send it to an email that was not functional, and I do have an email now. So I haven't given up my questions. Thank you.
Thank you. And I'm sure that you can speak with Animal Control if they have the paperwork or if they have any information on that PRA, I think it is. But I don't know that it has to, it relates directly to this item right now.
I believe, though, Animal Control determined that this is not a hybrid wolf with their DNA testing. So it's not a wolf being moved from Lake County to Mendocino County. We've already determined that.
Correct. Correct. Thank you.
Mr. Chair, you may want to have the Animal Control Director come up and just speak to that has been confirmed with Mendocino County, so that the record is very clear. But you're right, Supervisor, it was spoken to at the last hearing.
Sorry, I missed part of that. I'm Jonathan Armas, Director of Lake County Animal Control. I missed part of that. We're discussing the wolf hybrid portion. So correct, it doesn't meet any determination for fish and game purposes. There are some determinations, for example, from the California CVMA, the California Veterinarian Medical Association. Anything over 1%, which these dogs do classify, there are certain conditions for like rabies vaccinations and that type of thing. But it doesn't meet any limits for being considered an exotic animal within state or Mendocino County as being a wolf hybrid, which would have been 50%. So there are some nuances, but they have been handled and taken care of.
Okay. And Mendocino is aware of the information provided?
Correct, yes.
Okay.
They have all the documentation and everything.
Okay, perfect. And your time is up. All right. Last call for public comment on this item. All right, bringing it back to the board. And I believe you're looking for an action to move forward with the redemption.
Mr. Chair, if I may,
Please.
There was an appeal of this order, so it would be important to inquire of all parties. Is the appeal withdrawn with this resolution, or is a decision on the appeal being requested?
So at this time, because I don't want to, I don't want it to disappear at this moment in time, or I don't want us to take action on the appeal if then redemption is not completed. I want to make sure that we have that final step taken care of. So if the gentleman wants to pull his appeal, that is up to him.
Right. I think your board can order the redemption at this amount and get some indication that that's acceptable from the attorney for the animal owner.
Please.
Thank you, members of the board. Edward Seven again. As far as my understanding goes, the redemption amount is acceptable. Everybody's on board. There's really nothing left but for the attorney to sing, and I won't. It's a done deal as far as all that goes, as far as I know. And I believe the redemption will be made today.
And at which point the appeal will be pulled, or?
There's no appeal on our part.
Well, we have an official appeal because this is what brought it to the board in the first place.
Okay, well, we wish no appeal of anything. We're happy with the outcome, how it's evolved. So any appeal that's associated with Brandon Strasser or Tyra Matthews would be withdrawn.
That sounds good enough and official to me. And it seems to please our county council as well.
And you can indicate for the record that there are no pending matters before your board, but you do approve of the redemption amount, and note for the record that all parties have agreed to the payment in the amount of $3,389 and to adhere to all the conditions that have previously been testified to before your board.
Thank you for helping us. And looking for action, if somebody wishes to say so moved.
So moved.
Second.
We have a motion from
Second.
Supervisor Simon and a second by Supervisor Scott. Johanna, roll call, please.
Okay, Supervisor Simon,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska.
And she is absent from her seat at this moment in time?
Okay, and Supervisor Sabatier.
Aye.
Thank you.
Thank you very much, all of you. Okay, and so it is 12:46. We are going to go into closed session. Closed session will consist of 8.3, public employee appointment pursuant to Government Code Section 54957B. 1A, interviews of Community Development Director. B, appointment of Community Development Director. And then we will come back after our lunchtime, which we will do at 2 p.m. We will 2:30 p.m.?
I don't know if you need to announce the actual time of your lunch.
Well, we have to come back to open session.
Okay, why, so then, yeah, I think you could say return to open session at 2:30?
2:30, I'm thinking, gives us more adequate time. Okay, so then we will return in open session here at 2:30 p.m. Thank you, everybody.